maupun global. Bayangkan sebuah fakultas yang menjadi pusat inovasi teknologi dan tempat di mana ide-ide brilian diwujudkan menjadi solusi yang nyata. Fakultas Teknik dan Ilmu Komputer UMPP adalah ruang bagi para visioner muda untuk mengeksplorasi dunia teknik modern dan teknologi digital, membekali mereka dengan keterampilan dan wawasan global untuk membangun masa depan. Apakah kamu tertarik menciptakan solusi inovatif di dunia teknologi dan industri? Program studi teknik mesin adalah tempatnya. Di sini, kamu akan belajar merancang, membangun, dan mengembangkan teknologi mesin modern yang menjadi fondasi berbagai sektor industri.
Lulusan program studi ini siap berkarir di berbagai sektor industri.
Namun, dunia industri tidak hanya bergantung pada mekanik. Teknologi digital juga memainkan peran besar. Itulah mengapa program studi informatika hadir untuk membekalimu dengan keterampilan di bidang pemrograman, artificial intelligence, dan pengelolaan data besar. Di dunia digital yang bergerak dengan cepat, ini adalah kesempatanmu untuk menjadi bagian darinya. Program studi informatika di UMPP membekalimu dengan keterampilan terkini di bidang pemrograman, kecerdasan buatan, dan keamanan siber. Lulusan informatika UMPP dipersiapkan untuk menjadi pemimpin di dunia digital. Fakultas Teknik dan Ilmu Komputer yang fokus pada inovasi teknologi membuka peluang besar melalui program Sarjana Teknik Mesin dan Sarjana Informatika. Mereka membuktikan bahwa mimpi besar bisa diwujudkan dengan semangat dan kerja keras. UMPP juga menyediakan berbagai program beasiswa untuk mendukung setiap mahasiswa yang berprestasi dan berpotensi, sehingga pendidikan berkualitas bisa diakses oleh semua kalangan. Dengan dukungan kampus yang penuh inovasi, setiap mahasiswa UMPP siap menjadi inspirasi dan membawa perubahan positif bagi dunia. Jadilah bagian dari UMPP, kampus yang tidak hanya mendidik, tetapi juga membentuk karakter, kepemimpinan, dan semangat berprestasi.
Ayo bergabung di UMPP, menjadi bagian dari masa depan yang gemilang.
Setiap tahun, Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan menghasilkan ratusan lulusan yang siap melakukan banyak hal luar biasa untuk kehidupan manusia. Pelayanan ibu dan anak, merawat pasien, pengelolaan sediaan farmasi yang benar, mengatasi permasalahan gangguan gerak dan fungsi, meningkatkan kebugaran jasmani dan melihat banyak senyuman. Inilah Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan. Kuliah di Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan merupakan langkah awal dalam menyiapkan diri menjadi tenaga kesehatan dan pendidik yang profesional. Seorang tenaga kesehatan tidak hanya merawat dan pharmaceutical care. Lebih dari itu, Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan siap membentuk mahasiswanya untuk memberikan sikap yang hangat dan memberikan pelayanan yang terbaik untuk pasien. Selain menjadi tenaga kesehatan, Fakultas Ilmu Kesehatan juga mencetak calon pendidik yang terampil dan berdedikasi tinggi di bidang olahraga. Tidak hanya pasien, mereka juga disiapkan agar bisa berkomunikasi dan berbagi pengetahuan secara efektif kepada profesional kesehatan, masyarakat, dan pihak terkait dalam peningkatan mutu pelayanan kesehatan dan pendidikan. Karena mereka adalah seorang farmasis, fisioterapis, perawat, bidan, dan guru pendidikan jasmani.
Setiap karir yang baik berawal dari pendidikan yang berkualitas. Selamat datang di Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan, Pekalongan. Tempat di mana mimpi besar Anda untuk menjadi tenaga kesehatan dan pendidik berdaya saing internasional terwujud. Dengan visi menjadi Fakultas Ilmu Kesehatan yang unggul dalam ilmu pengetahuan dan teknologi.
Innani lakum minhu nadhirun wa bashir. وأن استغفروا ربكم ثم توبوا إليه ثم توبوا إليه يمتعكم متاعا حسنا إلى
in the discourse on mental health. Mental health is essential to overall well-being, yet is often overlooked on or misunderstood across societies and healthcare systems. Today's seminar brings together diverse voices, experiences, and insights from 4 countries: Indonesia, India, Professor Sharon Anthony from India, Dr. Khadijah Abdul Munin from Brunei Darussalam, and Dr. Tukimin Samsuito from Malaysia. The last name is familiar for me in Indonesia. Your presence enriches the seminar with your expertise and international perspective on individual mental health needs, the role of health worker, psychological approach, and culturally sensitive practice in health service. Let this event be a meaningful platform for exchanging ideas, tightening network, and most important, inspiring us all to contribute actively in enhancing mental health service globally. Thank you once again for your participation and support. I wish you all a productive and insightful seminar. Wassalamualaikum warahmatullahi wabarakatuh.
Well, ladies and gentlemen, the opening ceremony has concluded. We will now move on to the next agenda item, international seminar with the topic Health Services in Mental Health and Psychological Aspects, with our distinguished speakers. This activity will be directed by Apotheker Eko Mugianto, Magister Pharmacy, Philosophy of Doctor, as the moderator. He is currently a lecturer in undergraduate program in pharmacy and had a pharmacist education study program as well. He has finished his doctoral program in clinical drug development of herbal medicine, School of Pharmacy, Taipei Medical University. For full curriculum vitae, you could see in the screen. Well, I would like to conclude our opening ceremony by reciting Hamdalah. Alhamdulillahirabbil alamin. And I wish you all have a wonderful day by attending this event. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Everyone, please have a great round of applause for Bapak Apotheker Eko Mugianto, Magister Farmasi, Philosophy of Doctor.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, distinguished guests, and college esteems, and also students. It is an honor for me to welcome you in this seminar with the topic Health Services in Mental Health and Psychological Aspects. For your information, the reason why we do this seminar is because the big concern of people that suffering from mental health. There are more than 415,000 suffering of mental health around the globe. And the prevalence in Indonesia, more than 1.2% in Indonesia. It is a big concern for us in Indonesia, also in the world. So we have 4 big agenda for today's seminar. First, will be second, by Ms. Sharon Anthony. pedagogical-based health service approach. Before we start the seminar, I would like to read a poem. You can or a rhyme. You can say cool or current. When I finish, read one sentence. Step inside, don't fear to the start. Cool. Seminar hill, the mind and heart. Mountain tall seem hard to climb, but shared strength makes the journey fine. Okay, that's the rhyme to encourage us, to through these seminars. You will be guided by me. Start from this moment to 1:30 p.m. So the first presentation will be delivered by Dr. Eka Budiarto with the topic individual mental health needs as part of health service. To Dr. Eka, please come to the podium. Please big applause to Dr. Eka. Thank you, Dr. Eka. So, before we start the presentation from Dr. Eka, I would like to show you the curriculum vitae of the Dr. Eka. His full name is Dr. Eka Budiarto, Nurse Magister Keperawatan Sarjana Keperawatan Jiwa. He was born in Pekalongan in 1990, and his marital status, married, and she graduated from bachelor's from FIKES Muhammadiyah Pekajangan Pekalongan here. Before we changed the name from Universitas of Muhammadiyah Pekajangan Pekalongan, and he hold Master of Nursing in the Faculty of Nursing in Universitas Indonesia in 2019, and then he hold Doctor of Nursing in Faculty of Nursing in Universitas Indonesia in 2025. So without any delay and any postpone further, I would like to Dr. Eka to present the presentation. Dr. Eka, time is yours.
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Mr. Eko, now I'm very nervous. So I speak from the podium. Okay, thank you. Okay, good morning everyone and welcome to my presentation. First of all, let me say to thank you for this opportunity and say thank you for the audience and all of the participants, both online or the offline. Welcome from the participant from Indonesia, Malaysia, Brunei, and all of in the world. Europe, okay. So appreciate for us, okay. Please, applause. Today, I hope you are as excited as I am, because when I call to speak in here, I'm very interesting because the topic is very related with my educational background. I'm Eka Budiarto, and today I will to elaborate, and in the next few moments, I will to discuss together about the individual mental health need as a part of the health services. And then before I start, let me say hello to all the speakers. First, Miss Sharon Anthony, Miss Hadija, and Mr. Tukimin. It's nice to meet you all, even if it is online. And then, please let me to present. Anyway, sometimes we also recognize that discomfort arises when we get the mismatch between the expectation and the reality. So, for example, when we want to work hard, suddenly we get the sick. This changes that we consider that everyone not only has physical problem, but also mental health problems. The simple question is why mental health services deliver to needs aligned alongside mainstream medical services. Many kinds of reasons. First, about the contribution of mental health and substance use disorder to global health disease in burden and high unmet mental health needs, and then poor physical health and mortality index with severe mental illness, and the last is high psychiatric morbidity in primary and secondary medical care. All of indicate that it is very important for us for any health services, and then to integrate the psychological aspect or mental health aspect into their health services. In the slide you can see about the reason, and we know that basically everyone has the right to live a healthy life. For example, for this right is not only the physical right, but also all the right to mental health or psychological aspect. All of that, it actually should make us as health workers realize that providing services to patients must also priority the services of psychological aspect, even though patients only report about their physical problems. It has shown in a number of previous studies that physiological aspect is very important to the patient, for especially that psychological aspect greatly affect in the physical health and recovery of the patient. But health workers, it would be better if we know first about how to manage the psychological aspect as part of mental health services. You can see the slide where is mental health is an integral part of your overall well-being. Many kinds of the steps, there are 10 steps to identifying your mental health needs, starting in self-reflection until the listening to loved ones. Mental health is related to the everyone's well-being, and this means that indicator is when the person can do to the following step. For example, starting with the introspecting and becoming aware of your emotional state, and the next you can pay attention with your thoughts and the feelings and the behaviors, and then understand the mind-body connection, for example for the sign and symptom about the physical problems, and sometimes the physical symptom is need to the consult for the mental health or the health services. And then consider your social connection. Support system is the important. So do you have a reliable support system for your life? And then major life changes, for example, loss of the job, and then lack of the confidence and divorce and then etc. It is can make our mental health is not consistent. We can get the symptom of the mental health symptom. Maybe the cultural aspect is very important too, because the cultural norms and social expectation influence our mental health too. Personality traits, you can understand with your personality traits a lot about common mental health condition. For example, how to the patient with the stress, with the anxiety, with the depression, or the simple symptom. For example, the changes of the sleep pattern and etc. Keep a mood journal. You can feel your feelings and note down your emotion, triggers, and the coping strategies. The final is you can use the services, health of services, for example, to consult with mental health professional. By mental health professional, you can assess your need and providing a diagnosis and then recommended appropriate intervention. So please avoid the self-diagnosis and self to appropriate intervention. Sometimes the notice changes in our behavior before we do, and listen to their observation to take them seriously. And the next slide, you can see about the identifying mental health challenges. This is a 5 point. The point 1 is changes in behavior. The point 2 is emotional instability. And the point 3 is physical symptoms. And 4, changes in cognitive abilities. And the last is social withdrawal and isolation. We should also to be aware of the changes our patients are going to as well, because changes in their feeling, behavior, and functional are easy case. The key point to find the psychological aspect of the patient when we provide health mental services. For example, in the edition, also everyone can get the changes in the psychological function. Physiological function. For example, a person with the blood pressure and then the nausea and the vomiting is also indicate person with the psychological problem. So everyone who get the condition, we will get the lack of the confidence and the stress and prolonged sadness and then anxiety or the withdrawal and unwillingness to engage in activity and community and communication and changes in sleep and eating pattern. Why that can be occur in myself or in ourselves? In the slide you can see about the individual consists for the mannequin aspect, for example, the psychological aspect and the physical aspect. Any condition affect of entire person, not just a specific organ or system, but also consists of the psychological aspect. And basically, everyone has physical and psychological aspects that are interrelated. So that are interrelated to form health and illness. How to be the good health in ourselves? We must to collaborate between the physical and psychological aspect. So their interaction between the physical and psychological aspect is intensified by environmental, cultural, and belief factors. And in this point, one form of environmental is health services, with all it is associated with the all attributes can influence of our mental health. And then the providing health services by health worker must consider psychological aspect and mental health to be part of integral in the services. We can see that the psychological aspect of an individual related to truth and emotion. So we can conclude that the psychological aspect is continually being shaped and influenced by experiences, by the environment and person state of the health. Patient will respond to the services that we provide in the form of the thought and emotion. Good health services make patient feel positive and feel positive thought and positive emotion. With the positive thought and certainly we can create a flow of the positive energy in the patient bodies, which impact of positive things such as compliance and the satisfaction and the motivation. So it is very important for us to give the health services. In the next slide, you can see about the cycle of human life. Next, please. Circle of human life. Yes, this is, you can see from infants until the elderly, everyone have a psychological development test. And as we can see, this cycle human life, that each age group has its own psychological development. For example, in infant, trust, in preschool, initiation, and school as industry, and the maturity or the example. If when we provide health with services in the elderly, when we can do something with our services in elderly, we are required to have more listening skill to elderly, present ourselves by physical and psychologically. The next slide about the mental health needs in mental health services. The next, please. The next, please. Yes. About mental health needs in health services, in providing health services, individually must be physical aspect, but also observing how a person emotional and mental condition can affect their well-being. So psychological factors such as stress, anxiety, self-confidence have been shown that to have a significant influence on the immune system and the blood pressure and even the risk of the chronic disease. To give the optimally mental health or the services, health services, we can do something step. In the next slide, we can see. In the next slide, we can see about the building trust and willingness to communicate and emotional presence and the appropriateness to ensure that we accept our patient into our health services. We need to make sure that we have done these things that consists of building trust with our patient and willingness to communicate to our patient and emotional presence in our services and appropriateness between patient and mental health workers. I have a for illustration in the next slide. For illustration of the integration of psychological principles into the healthcare, for cases about the management of mental health, management of emotional in patient with cancer, management of atrial fibrillation, physiotherapy curriculum, and work-based mental health intervention. You can see about the point, setting, disciplines, patient, model of the psychological care, principal component, and principal target of care. This is a physical problem. The patient with the cancer, patient with the atrial fibrillation, this is a physical problem, but in their bodies, the patient get the mental health problem. So we can get the mapping from the discipliner. For example, in the patient with cancer, we can see medical oncology, nursing, and psychology. In psychology aspect, maybe we can deliver our services by direct care or indirect care, collaborate care, or the independent care with the nurse and the medical oncology. In the for illustration, we can see that primary target in mental health, behavior, and cardiac health. So between physical and the physiological aspect can to give the services together. And for example, the word-based mental health, actually, literally, this is a mental health point for the principal target. Maybe I think that's all for me. Many shortcomings, please be forgiven, and hopefully we have seen together can provide benefit and blessings. So thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Eka. And give big applause for Dr. Eka for great presentation. So the next section is the discussion sections. I'm about to give one question from the floor and one question from online participants. Anyone have a question? Please raise a questions. Or yeah, just to trigger the discussions. I would like to ask a question to Dr. Eka. You mentioned, you said that in the first speech that we cannot self-diagnose ourselves whether we have a mental health or no. So in which situation, in which circumstance, we can diagnose that we have mental health. So do we need a mental health service or no? Please.
Okay, thank you for your question, Mr. Eko. In that foundation, the good intervention for the solving our problems. So when we get the self-diagnosis is not true for our life, because in my life the professional mental health in the services health services actually we don't have enough knowledge to self-diagnosis. We can get the sign and symptom from the social media. For example, how to symptom and sign patient with depression, and sign and symptom patient with anxiety and stress, and etc. But to diagnose or to the self-detection or the early detection is not so simple that we can see in media social. So we must go to the mental health professional to get the mental health services that good quality. Thank you.
Thank you, Dr. Eka. Anyone have a question? Please raise a questions. We have 15 minutes to go from now to discussion sections. Anyone? Please raise a questions. Okay. Or in online participants, if you have a question, please raise a question by typing in the text or in the message or in the floor. Have a question? Yeah. Regarding to Dr. Eka presentation, there are 10 steps to identifying the mental health needs. Yes. Yeah, please. Someone, could you do me a favor to give a microphone to her? Yeah. The question comes from the students. Please mention your name and where you come. Okay. Waalaikumsalam warahmatullahi wabarakatuh.
Saya izin bertanya menggunakan bahasa Indonesia ya Pak?
Yeah, go ahead.
Ya. Jadi begini, terkait mental yang remaja milikin itu. Oh iya, mohon maaf sebelumnya. Perkenalkan saya Husna Nur Afdilah dari D3 Keperawatan tingkat 1 atau semester 2. Pertanyaannya itu terkait tentang mental yang dimiliki dari para remaja. Dia itu terkadang karena adanya suatu masalah dari keluarganya atau orang tuanya itu sehingga sangat mempengaruhi kesehatannya. Tetapi di sebagian prinsipnya dia itu ingin menghormati orang tuanya. Tetapi pilihan orang tuanya itu sangat berlawanan dengan apa yang anak itu miliki. Jadi ketika si anak itu menjalankan sesuatu yang diinginkan dari orang tuanya, yang diridhoi dari orang tuanya itu terasa berat. Sehingga itu akan memungkinkan munculnya dia tidak sehat secara mentalnya ataupun dia menjadi terpuruk. Nah, bagaimana kita bisa mengatasi hal tersebut untuk menjadi seorang anak yang bisa berbakti kepada orang tua juga, tetapi kita bisa menjaga mental kita. Begitu Pak pertanyaannya.
Okay, thank you.
Sekian, terima kasih.
Your name? Ana.
Oh, namanya Husna.
Husna.
Yeah.
Yes. The question from Husna.
Ya, terima kasih.
From vocational nursing programs. She asked about like a burden for the teenagers, when she or they have a mental health problem or mental health issue. How to express their issue to their parents, because sometimes it is like a problematic for the teenager.
Okay. Thank you to Hasna or Husna? Husna, for your question. Is good a questions. To answer your questions, we must remember about the cycle of human life. Actually, now you in position teenagers, in adolescent. In the teenager, the development of psychological test is identify your identity. Every teenager have opportunities to explore your environment for your goal attachment and etc. So the teenager have human right also about the mental health. For example, to elaborate about your aspect of your life. But the case of your questions, I think this is not simple recommendation for me, because we must to remember again the cycle of human life from the infant. If you have finished with your development psychological test in infant, you can save your life. But after the infant, their infancy or the early childhood autonomy. For example, for autonomy is you feel free to doing something in your family. For example, to have the cooking, for have the cleaning the floor and etc. When you can get you cannot get that opportunity in your early childhood, you can get the big problem for the next stage. For example, in the preschool initiative, or you can loss of your mind to initiative to doing something. For example, you can have a question for your parents about the why the sky is blue, why the mountain is tall, and etc. The next stage in the school age industry, you can lack of the opportunity to get something that you can have the reward from yourself. For example, you can get the to be number one in your class and to be the winner in the every opportunities and etc. So we can go to the when you state in your problem. So and in addition, you can communicate by your family. If you have what is the you can communicate with your what do you want for to your family, to the basic to take the decision, to take the decision. So this is not short and easy problem. The comprehensive intervention from the infant until the teenagers, we can detection, we can to assess with the development psychological test before to get the good intervention there. Thank you.
Usna, is it answer your questions? Okay. Anyone? Please raise a question, or in online Zoom meeting? Yeah. Please. Someone, please do me a favor to give microphone to someone up there. Yeah. Yeah. Please. Yeah. Mention your name first.
Perkenalkan, nama saya Faturul Azim dari program studi fisioterapi semester 2. Jadi pertanyaan saya itu, in the context of providing health service, how can healthcare professional integrate emotional and mental health consideration such as stress, anxiety, and self-confidence into patient care to improve overall health being and reduce the risk of chronic disease. Terima kasih.
Okay, thank you. So, Azim asked about how to integrate all the mental health issue. Yeah.
Yes, Thank you. About the whole to providing to integration mental health in the physical health in mental health services. In mention not only about physical problem, maybe in the chronic disease, for example, diabetic mellitus. We can serve the patient about the physical focus, for example, how to manage pain, how to manage the disrupt of their skin integrity, and etc. But also, but in this section, we must remember everyone have a psychological aspect, the basis data from the human cycle, human life cycle. So each of the states then become the basis for us respond to the patient according. For example, the diabetic mellitus patient in the elderly is not only we must to solve their physical problem, but also in mental health problems. We must to have the more and more listening skill in elderly, so we can present ourselves by physically and psychologically. So to providing the health services in the many kinds of the cases in the mental health service or in the clinic, we must remember also beside the physical aspect. So we must give the many things about it that make the feel comfort in every patient. Okay.
Is it answer your questions? Okay. Thank you. I think we have 8 minutes to go to have a discussion. Anyone have questions? Okay. Yeah, please. Gumilang. Yeah. Once more questions.
Excuse me, let me introduce myself. My name is Muhammadiyah. I am undergraduate study of pharmacies. Let me question how important to for the health service and mental health is a factor of empowerment or parenting or in your material. Which one the important factor is a health service?
Yeah.
Thank you.
Yeah, I think Gumilang asking about those issues that influence the mental health. Which factor is the most or the prominent factor to affect the mental health?
Yes. About the factor affecting in the mental health services, beside the development of the task and the environmental and the situational and the actually patient condition. This is two points that important is one, opportunities to get the good develop our psychological aspect. For example, when we have opportunities to speak up with our opinion, but the environment not support you, this is very dangerous to develop your confidence. For example, that the mental health services can be good providing to all of the patient must consist of the remember the development task and the situational actually in this condition, and parenting pattern, and how to make a decision, because everyone sometimes cannot make their decision because their background in psychological aspect is not good. That's it.
Hopefully answer your question, Milan. Okay, I think the time is enough. Now 9:15. Yeah, we have 5 minutes for the conclusions. Let me conclude from our discussions. There are 10 issues that to identify the mental health need. The first, self-reflection and awareness until listening to loved ones. And when you have or you have a symptom of mental health, please find mental health providers. Yeah, don't judge yourself. Yeah, what kind of is my have a mental health disorders? I think it is not a good decision. I think that's enough for the next session. Is the presenting of the certificate, and this section will be taken care by Ms. Aisyah.
Thank you, Pak Eko. Today, now is certificate submission by the Vice Rector of Academic Affairs, University of Muhammadiyah, Pekajangan, Pekalongan, Bapak Dr. Muhammad Arifin, Magister Keperawatan. Would you please hand over the certificate to Dr. Eka Budiarto? Thank you very much.
For Dr. Eka, because we still have a next agenda, which is like respect to the floor, and for the participants, either in auditorium of Muhammadiyah Pekajangan Pekalongan or in the online Zoom, we now go to the next agenda that's presented by Ms. Sharon Anthony with the topic college, his college counselor, Department of Psychology, Universitas College, Autonomous, Bengaluru, India. For Dr. Eka, thank you. Okay, for Miss Sharon, are you there?
Yes, I'm very much with you. Good morning, everyone.
Please give me 5 minutes to set up
Sure.
the situations. Okay, the next agenda will be delivered by Ms. Sharon from Jyoti, from Jyoti Universitas College, Autonomous Department of Psychology, with the topic, the role of health workers in mental health. Before she delivers the presentation, I would like to show you his background. So he involved in many. She involved in many activities, social activities, like beneficence, non-malfeasance, justice, confidentiality, and fidelity, and etc. And also, she has a professional competence, knowledge, skills, experience, clinical skill, communication skill, teamwork, collaboration with the patient, and safety consciousness. And she published the research book of she give to us the power of empathy, and this book, and I would like to from the slide. She is an independent and self-motivated and energetic person, passionate to work with individuals, groups, and communities to improve mental health in the 21st century. And she has many skills, and I will mention one of them. Counsel over 100 cases on personal issues, physical or psychological change, group dynamics, cultural difference, and disorder. And she has experience in many different fields, like student counselor in Euro School, and she also has life skill teachers and counselor, personal therapy, and Pixel for heads, founder, and creative consultants. I think her expertise is undoubtable. And without any delay, her presentation for Miss Sharon Anthony, time is yours.
Thank you so much, sir. I'm so happy to be on this platform, and I would really, be humbled to speak to such a large audience from representing our college, Jyotinivas. So, with no further ado, I would like to tell all of you a story to begin with, right? So this is a story about a couple. I'm not sure. Okay. Yeah, this is a story about a couple who is Indian, and the girl is Indian, and the gentleman is from abroad, right? And he is the citizen of a different country. The girl is an Indian girl. So now they decided to have a baby, and the pregnancy went pretty well. The government generally gives, them a midwife, and the medical checkups are all, handled by the government. So while the service prevailed, I'm going to be sharing the experience through the pregnancy and after the child was born. So in September, the first week of September, she gave birth to a baby boy. Right? There had been a small complication. The child had been born with jaundice, and so generally when this happens, they put the child in an incubator and heal the child, and after the child is healed, they get to go home. It's a very common occurrence that takes place in childbirth these days. So while this was happening, this client also had the experience of having to change different midwives throughout her pregnancy. Initially, they told that they will give her one midwife, and then she's really happy with the support because she does not have family abroad. It's just her and her husband seeing the pregnancy through. So she really thought that the midwife would be amazing. Moving forward, after she gave birth, they changed the midwife, right? And so the midwife was present at birth, and since they figured out that the child had been, unwell, they took the child away, to the incubation cell. And they would bring back the child during feeding time and then take the child back to the incubation cell. And this kept happening, right? After a few weeks, they're like, oh, you know what, this is more than enough, and you can take the child and you can go. Although, as months went by, the case just kept getting complicated with the child's health. So they kept moving back and forth with different, visits to the hospital and things like that. Before long, they started realizing that the child had a very different breathing pattern, and they wanted to consult with the general physician. And over there, it's not like we can get into any hospital just like that. You need an appointment, and after the appointment is given is when you can actually see the doctor. So the client had booked an appointment with the general physician just to check the breathing, and they found out that the child actually was not doing good, and he had an episode where he couldn't breathe too well, so he had to be rushed to the emergency. In the emergency, they took him to a bigger hospital and did a couple of scans. And here's the catch, right? The doctors and the nurses and everyone kept the mother and father, if I can use the word, held captive, right? The mother and father had no idea what was going on, and they didn't know what was going on with the child's condition, and nor were the doctors communicating with them, telling them what was going on. And, there's fear and anxiety building within the parents because they have no clue why the child is kept away and why they are kept away. Later, they found out that there was a fracture on the child's rib cage, right? There was a small fracture, and they said that it was healing. But mind you, around this time, the health services got the social service involved in this case, where they came in assuming that the child's parents harmed the child, right? Hey, over here it's just protocol. If cases like this come in, it is the responsibility of the health caregiver to make sure that everything is going all right, and having to make sure that the child is safe as well. So they were just following protocols. But mind you, around this time, the parents are still unaware of what exactly is going on, and they want their child, they want to see their child, and slowly they gave access to the child as well, and they kept all of them in a room. They said that they had to run a couple of tests on the kid, and after which they will let them go. They were in the hospital for uncalled for 3 days, right? Held captive, running different tests on the baby. I'm going to mention one episode that took place with the tests, the child, the mother, and the father. So they are rapidly doing tests one after the other. They had to dilate the child's eyes, so they were doing a full body checkup from head to toe to make sure that the child is doing okay and there are no other complications apart from the damaged, rib that they found. So they had to pour eye drops into the eyes to dilate the child's eye. Right, and it takes some time for the dilation liquid to do its work. And while this is taking place, they realized that they didn't pour enough of the liquid. So they poured more liquid into the child's eye. And mind you, the child is having a terrible time, crying and crying and crying all throughout. Firstly, the child has been handled by someone new, and the child doesn't know them, and the child's discomfort is very obviously seen, and so everyone are trying to, like, hold the child down, just so that he doesn't shake or move while they're conducting all the tests. Right, so they came, and while they were waiting for the dilation to take place, they come and tell the mother, oh, you got to go to the x-ray department, because if you don't do it now, then they're going to close, and they won't be available. So now here we have a child still having their eyes dilated, and now they've gone to the x-ray room, taken the x-ray, and by the time they finished all of this and came back, the effect of the dilated liquid in the eye is gone. So now they have to do it again. And now again they're pouring the liquid into the child's eye, and the child is just overwhelmed, overstimulated, and not having the best day. Right? Over here, imagine what the parents are going through, watching the child's cry in high pitch, right? Not able to do anything because they have to follow protocol, right? They have to cooperate and not throw a fit, because already they are being accused of hurting the child. So they have to be on their best behavior. At one point, the father, who was a citizen of that place, voiced out and said, hey, you know what, give the child a break. We can be here for however long you want us to, but please don't torture the child. He is very uncomfortable, and we need to run the tests slowly on him, and we can't have it so sudden, one after the other. After all the tests were run, mind you, it was a very disturbing time for the parents. Well, first of all, they don't have any help. Secondly, there's no lawyers that they can go to and say, ask for justice regarding this, and or to prove their case, because they're not giving enough of time. So this case was with the hospital for over 10 months until they decided to dissolve the case. And mind you, during these times, once the parents' names have been listed, then they have different random checks. So people just walking into your house at odd hours and asking you, not odd hours, but of course working hours, but at any point asking you to open your door and allow them to come in, and or the risk of having to not have your child with you forever because social service is involved, right? And the mental state that both the parents were left at, one can imagine how devastating it might have been, not just for them, but also their family, who are so far, far away from them, who are just so helpless, not able to, give them physical support. The least that they can do is video calls. Right, but there's no one to talk to, there's no one to help them out of the situation. They just needed to go through the protocol and follow the procedures of what they had mentioned. Now the client told me, hey, the only time that the child was away from me was the time when they were taking the child in and out of her room to the incubation cell and the incubation cell back, because she has not dropped the child, and or no one from outside has come inside, and there's been no accidents with the child at home. So the only thing that she could think of is the midwife and the nurses who took care of the baby at an infant stage, because what they found out in the x-ray was that the rib cage was healing already, which means to say that it's happened a few months ago, right? This could have been one of the reasons why the child wasn't able to breathe properly, and having crying spells and a lot of discomfort during those months. in January of 2025, with a lot of back and forth and everything, this case was closed, saying that the parents were not found guilty and there was no evidence that the parents hurt the child, and so the hospital was going to close the case. Y'all might be wondering why exactly I'm telling you this story, right? There are few things that we need to keep in mind as health workers, right? One is the parents could have been getting a lot of grief for the cultural differences that they are in their physical appearance, because one is an Indian and the other one, of course, is the citizen of their country, but at the same time that didn't have prevalence for the Indian citizen, right? She was properly treated differently in the hospital, also because of her color and her race, right? But with that said, we need to also keep in mind during this time how the families would have had their mental health along with the parents as well, right? We need to keep in mind the patient comfort that the hospital's protocol was taking. And even though the doctors were really kind and polite, saying, hey, you know what, we're just following protocol and we need to do this and we need to, go through all the steps of the social service, since the social service is involved. One thing I wanted to point out is the teamwork that the social service, the hospital, all the doctors and everything, they all are one big team, right? And the impact that they have on this parent along with the child and their families is immense. While they were following protocol, they would have never imagined what the families were going through during this time, right? So here I am today speaking about this, where we need to work together for better quality and ethical work in our health care department around the world. It's not just India and or Malaysia, but everywhere. We are going to be the future of healthcare workers, and it's important for us to learn how to be in the field ethically and with quality. So today I'm going to throw a little more light on ethical ethics of health worker. I do see someone has a question, but I will get back to you in the Q&A section. So beneficence is basically some thing that we all need to have, right? It's the act. It's to act in the best interest of the patient. Over here, every single case is going to be different. Every single person is going to be coming with a new thing. So we cannot always apply the first case to the second case with the same treatment or the intervention plan. We need to have the flexibility of understanding what is the need of the patient and act accordingly, right? I would also like to talk about non-maleficence. Over here, it's the duty to do no harm, right? In our story that we heard a little while ago, the nurses, when they're seeing the mother in pain, when they're seeing the child in pain, right, there could have been a little flexibility in having to say, hey, you know what, let's stop. Let's actually give this child and the mother a little bit time, and we can continue the tests and keep them safe, right? So we need to make sure that the health workers must carefully consider the potential risks and benefits of any intervention and avoid actions that could harm the patient in any way. Autonomy, right? Over here, there are chances where even we might have an opinion, but it's not the decision that the patient wants to take. Right? For example, if I'm trying to learn my client how to draw boundaries, and if my client is not ready to draw boundaries, then I can't force my client to do so immediately. I need to be able to give that space to my client for the client to be able to grow and understand that this is what I need in my life right now, right? So it's very important to make sure that the patient's right to make their own decisions is respected. And we need this also includes having to provide significant information for informing consent and respecting their choices, even if they differ from ours, right? And our recommendations for the client. Justice. Now, over here, treating all patients fairly. It really doesn't matter the economical status that you come from, the social background, your gender, or your social standing. What is fair is to be giving the necessary treatment plan and whatever else equally. For example, in our story that we have mentioned, just because there's a racial difference, it doesn't mean that they are not human. We are still human beings. Every one of us, doesn't matter where we are, and we need to be able to give our client that confidentiality. One of the most important, things as a health worker we need to carry with us. No discussing any information about the client without their consent. Even the story that I shared with you today, I took consent of the client and I'm sharing with you today. If not, I would have never given this as an example also. So we need to be able to give life respect, right? And so each person's experience is theirs. If they're willing to share, we can. If they're not willing to share, it's not okay to share. Of course, confidentiality can be breached in, specific legal aspects and or ethical circumstances. It's something that, we are allowed to give out, but that also, how much are we giving out, right? You would make out that not once have I mentioned which country this happened in, and or where exactly is this taking place, or any details of the client that went through this. I have maintained complete confidentiality of the client. Fidelity, right? In no matter what we do, we need to maintain trust and loyalty in the patient health worker relationship, right? This involves keeping promises, being truthful, and acting with integrity, right? If you told them, hey, tomorrow I will come and play ball with you, and we can play basketball together, then do it. Don't be like, oh my God, I don't think I have the energy today for, carrying out what I told you yesterday. So maybe we can do it another day. Now that's going to create a breach in your trust and your loyalty with your patient. It's just a small example, but, and it's hypothetical, but I'm just like having to share this with you. Integrity, right? It's so important to be honest, transparent, and have moral principles, right? Even in the story that we discovered initially, it would have been so much more nicer had the doctors been transparent in the beginning itself, not having to have the parents go through that for nearly half a day without knowing anything at all. Right? Of course, I do understand there's a protocol that needs to be followed, but there needs to also be ways to gauge when to break the news and when not to break the news and things like that. So, respect. Showing consideration for the dignity, values, and beliefs of each patient, right? We might come from different races, we might, come from different castes and religion. It doesn't matter. We still need to embrace the humanity, and that's where our health workers, play a vital role in having to uplift the love and compassion that people experience in this field. And we need to come together as a team to work and bring out that. They also need to be able to believe in health workers. See, if we have unethical practices, for example, in our story earlier on, it could have been any nurses and or the midwife who hurt the child, and they might have kept silent about it, not having to tell anyone anything. Now, had there been honesty and transparency, saying, hey, you know what, the child slipped from my hand, and or whatever could have been the case, came and told the parents, then the child could have got the help that maybe it required at that point in time, right? It wouldn't have had to go with an undiagnosed broken rib for those months and so much of pain that was put through the child. Taking accountability. Taking accountability and responsibility for one's actions and decisions is so important, right? Even if it means to say that if we've made a mistake, it is important for us to acknowledge that mistake, saying, hey, yeah, I'm so sorry, I forgot to give you your medicine at the right time, but please do take this medicine and, heal. And or if there's anything that we have done, as a small error, it's important to acknowledge it to ourselves first and then to the other. It's only respectful to do so. Next, I would like to talk about the quality of the health worker that we possess, right? Possessing the necessary knowledge, skills, and experience is our job. We are in a field that is of the sciences, and it's ever growing. That's one field that never stops growing. Research is always updated, and it's our responsibility to keep learning for the rest of our lives because we want to do justice and give the newest version of research and practices to our client, right? So please do not ever give up on having to learn the newer things of the world. If we go to a therapist, for example, if they are 60 years old, the therapist, right? They're very experienced at this point. They might have seen so many different cases. But if they're practicing what the books taught them 40 years ago in today's world, it's not going to work out, right? We will still need to be, for example, aware our world is so digitally equipped, right? If we don't know how to use WhatsApp and or just basic things, I'm not saying that we need to. I'm just giving you an example of how the 60-year-old therapist still needs to be in keeping with today's generation and today's world and how it works in order to be able to carry out a good intervention plan. Right, for example, even let's say midwifery, if we don't learn the newer sciences of the practice, it's not going to help. I'll give you a good example. Let's say before, I'm not sure if any of you have experienced this and or seen it, but if anyone gets a seizure, over here, they used to give a key to hold, and they'll put something between the teeth of the patient who's having a seizure. Right? Newer sciences tell otherwise. They will tell you, turn the patient to the left side, make sure that the patient is, in a safe environment and not banging their head anywhere and or hurting their body. You don't need to put any key or anything in their hands and or in their mouth. The seizure needs to see it through. And after some time, the person will regain conscious. But we need to just find a comfortable spot because we cannot stop a seizure midway. There's no way in which that can happen. So there is a way to, shield the patient from having to do so during this time, and that's all that can take place. So do you see how older generations, they used to deal with one thing one way, and then in the new generation, they deal with it a different way. So yes, moving on. Communication skills. Effectively communicating with their patient, parents, and other healthcare members of the team. Over here, if we all collaborate together, if we don't know something, it's our right and just and our duty to ask for help. I keep telling my fellow supervisee, I supervise and I teach, other students how exactly to counsel, the techniques, the tools, and everything. And I keep telling them, when it comes to counseling, please make sure that you're respecting your client in any which way. Communicate properly to them, right? And we need to be able to provide them decision making space, right? If it is not a part of your expertise, give the case to someone who it is a part of their expertise. And or if you're not able to get an intervention plan, please approach your supervisor and ask for help. If someone doesn't like my way of therapy, I don't feel bad at all. I tell them, please go ahead and find someone who works with you better, because it's not about a ego punch and or, oh my God, how can this person not like me? It's more about we are a part of a community and we're giving a service for one common cause. And that common cause is for the better mental health of people in my practice. Of course, in each of different health workers, we all are one team, right? So never feel be put in a place where you have to push down another peer of yours for your betterment. You should always leave room to be able to grow and make sure that everyone is a community. If someone's not working well with you, put them in touch with a friend. It's about having to form friendships, not make walls between each other, right? We are one team. We need to work that way. Patient-centered focus, focusing on individuals' needs, preferences, values of the patient, and this also involves empathy, compassion, tailoring to meet their specific needs and circumstances. I think Mr. Eka very nicely emphasized on how one needs to listen. It's so important to listen to what they are saying and don't listen to respond, listen to understand, right? Understand how they are feeling, empathize how they are feeling, right? So this is something that we really need to look at too. And safety, we need to make sure that all the protocols are, in place, right? For example, even in this healthcare example that I gave you, the doctors were only following protocol. In some ways, there's nothing wrong in it. It's just how it was done. It could have been more kind. It could have been more compassionate, considering that we all are human beings, right? Efficiency. We can't have a patient with us saying, oh, you know what, if I have one patient and if I do 10 sessions, I will get 10K out of this. No, it's more about if this patient can heal faster in 3 sessions, then give the patient that. Right? We don't have to hold back our knowledge and our skills depending on how the patient or the benefit of our financial status or anything of that sort. When we give with a true heart and we work efficiently. If one case we know is going to take 3 months, then it's going to take 3 months. If we know that one case is going to take 1 month, then it'll take 1 month. It's how we utilize the resources effectively that we provide them in timely without having to unnecessarily delay and or waste any time. Continuous improvement, right? It's so important for us to be having to hold a space for ourselves, to be able to reflect and seeking opportunities to enhance our skills. Now, ethical conduct is so important for us.
Recording in progress.
High quality care that we give to others. I have spoken about therapeutic rehabilitation, but there are a few things that I'd like to emphasize on. In therapeutic, and rehabilitation support, facilitating therapy not only can happen to individuals but also in groups, which means to say your patient might be a client of autism and or it might be a client who is pregnant. We not only have to look at the patient, we also have to look at their families, right? How exactly can the families also support the patient during this time? So seek therapy. It's one of the best practices that we have in the world today. So I'm not forcing it on you because I'm in the profession. A lot of people also do different things where they go to like Buddhist groups and or find the inner peace in different ways, and so be it. But it's important for us to work on ourselves and give ourselves that growth and healing, right? Developing coping skills. It's so important that we help individuals develop and practice coping strategies to manage their symptoms of stress and whatever triggers they might have too. Prompting recovery. They focus on, empowering individuals on the recovery journey, right? Fostering hope, resilience, and a self of efficiency in this place too. It's so important to give hope to your client, right? Letting them know that they can do it and they can come out of this. Just having to have that support and encouragement. Enhancing community. You can change the slide, please. Please change the slide. Yeah, I'm talking about enhancing community living skills right now. They may have assistance with having to, develop skills necessary independent living in the community, such as budgeting and transportation and social skills and everything like this. So it's really important to know how much of access our patients also have living within the community and helping them, get the knowledge. For example, buses have provisions for people who are disabled in different ways, be it any kind of disability. They have provisions and a spot. They need to know their rights. They need to know how exactly they can access these rights, right? Which is why there is also, I want to throw light on collaboration and advocacy, right? In teamwork, they work as a part of a multidisciplinary team, all of us. We're not just one counselor over here. I have psychiatrists, clinical psychologists, midwives, doctors, and many other professors, physiotherapists, you name it. We all are one big team, whether we know it or not. And it's so important for us to come together and, work together. Even if you are a nurse and or a social worker, we all provide such amazing energy into this field, and we need to be in it with respect and dignity, right? I would like to speak a little more on family support, how we can provide the guidance and emotional support to those patients who have and are dealing with the patient, right? Having to let them know with whatever sensitivity and or helping them understand the condition of the client is so important. How to be around it is so important. And even communication, how we do it. We need to speak in a very polite manner. We need to be able to have, mannerly body language as well, right? We need to work with grace and poise. We can't be rough and tough and, be rude and or mean. We need to be able to gauge and act accordingly. And can you please change slide? Before I conclude, I would like to talk to you about how certain books I would like to leave you with to enhance better understanding of the topic that I spoke about. Please change slide. Yeah. So the first book is, please take note. You can feel free to take pictures of this. The first book talks about, complex ethical issues surrounded with different consent, patient rights, and social determinants of health through the compiling stories of the author. Right, so this is a lovely book for you to get a little more insight on this. The next book speaks about a neurosurgeon who was diagnosed with terminal cancer, right? It offers a unique perspective of patient experience. This is when breath becomes air. I'm talking about that book, actually, the third book, sorry. The Spirit Catches You and You Fall Down is a book that throws emphasis on cultural competency in the healthcare field, right? It's something that a family went through in the American medical system. So it's really important for us to, like, enhance our knowledge on this and grow with different books and resources. The other one that I'd like to leave you with is communication and interpersonal skills. It talks about, different strategies for navigating challenging conversations with your patients, families, colleagues. It also talks about the next book on empathy. Obviously tells you more on how you can be more empathetic. Next slide, please. We have two more books on professional development and self-care. And I really hope that these books, give you the kind of growth and knowledge that you possess in the field ahead. So I, with this, conclude my talk for today. Just to summarize, let's all be passionate to our field of learning and enhancing our knowledge in the sciences. And most importantly, we need to be compassionate in the field, because it's a field that we can give a lot of room for burnout as well, where energy can get drained, and because of which we can be, irritable and or have our own challenges. So we need to be able to catch, our symptoms earlier on and not reach a level of burnout in the first place. So in all of this, please take care of yourself, because if you don't take care of yourself, you will not be able to take care of others. So go for therapy yourself and then give therapy to others. Thank you very much.
Thank you, Ms. Saran. It's a great presentation. Please give a big applause for Mrs. Saran. Thank you. So, for the next section, discussion section, we have 15 minutes left. Anyone have questions for Ms. Saran from Jyoti, India? Yeah. Either in offline or online. Someone please raise your hand. Yeah. Ms. Serans, just to trigger the question from the online or the offline participants. We know the concept of patient safety, right? And we also want to know in which circumstance the mental health overlap with the patient safety. Yeah, because it is mostly overlap each other between the patient safety and mental health. Yeah.
If I understood the question correctly, basically you want me to answer how exactly is patient safety and mental health related, and how exactly we keep, how do these two come together, and how we keep the safety of the patient. Have I understood that correctly?
Yes.
Okay. That's such a lovely question. For this, I would like to say that it's so important for us to know our patient first, right? Having to build a rapport, having to understand their likes, their needs is so important for us to be able to gauge what exactly this patient really requires. Patient safety, we first of all have a protocol in place, right? We can't go away from that. For example, when I start my sessions, I generally tell my client, with your consent, if there is harm to self, harm to others or harm to society, confidentiality with your consent will be breached, right? Which means to say that if I'm dealing with a suicidal client, I still need to know that my client has other measures of safety. So I will need to have another contact and or provide the client with the necessary help that they require during this time of healing, right? So we do have a protocol to face. So in each sector of whatever whatever field you are in, your protocol will have to be followed, right? But it is also important for us to be able to gauge the mental health that we are going to be contributing in this time to the patient. For example, if I know my client has been continuously, having suicidal ideation, I'm going to tell the client, hey, you know what, do you remember the first session we had? I spoke to you about how we will be breaching confidentiality for your safety, right? I'm now going to mentally prepare my client for what is to come. So for the breaching of the confidentiality also, I mentally prepare my client. So I'm not only following protocol and safety, but I'm also following safety of my client's mental health, trying to protect it in the best way I can, right? I think one thing in our profession is it's also quite blinding, the justice that we do and or the service that we provide to our patient, right? There's no in few cases, yes, we can see physical change, but in mental health you can't really see it. It's something that is experienced and it's something that is felt. So it's important for us to be able to give that to the best of our ability in whatever we feel is just and fair at that moment, right? So this is how we gauge the safety of the client, protocol wise and also mental health wise. I hope this answers your question. This is one of the ways.
Thank you, Ms. Sharon. We have one question from undergraduate. Her name is Dila, and she asks, I would like to ask, many university students experience anxiety and burnout due to continuous exams and tight deadlines. At what point should we consider academic pressure as harmful to mental health? And can doing something we enjoy, such as watching our favorite idols, actually help reduce stress in meaningful and healthy way? Yeah, I think it's a good question.
That's a very good question, actually. If I've understood the question right, you want me to answer how exactly we balance the academic pressure versus your own quality of health, and where is the line between these two? Let me tell you something. Okay, in our field of health, right? There's lots to learn. And we can't run away from it. We have to study it. We have to understand it. We have to, go through the necessary content to be able to apply it in the future. And it's crazy to have just everything crunched up in 2 years. And I do understand the academic stress and the pressure, because once one assignment is over, another comes in, and so on and so forth, and it's never ending. There's exams and everything going on. And at the same time, we have the luxury of youth that we get to experience alongside it. I would say that academics need to be prioritized, and not cause of anything else, because we need to be able to give our patient the best and the most efficient way of having to give our services. Right? And if we don't learn it and if we don't practice it, then we won't become it. And to become it, it takes a lot of time and effort. And if you're not going to be putting those hours in every day of your life, then you may not be the best quality, or you may not be reaching your best potential. So I think it's really important to be able to gauge internally and self-reflect on how exactly you can give yourself the best potential in your academic growth. Now, for your leisure and breaking out of the stress, don't stop being you, right? For example, if you're a person who likes to draw, give yourself 5 minutes in, maybe let's say once in 2 days or once in a week, to do that. Give yourself the time to take a walk in the park. Give yourself a time to, like, perhaps go sit down and drink your coffee at leisure. But you need to be able to keep time in your mind. You need to be able to keep the responsibilities in your mind. If you have a submission on Monday, and if you're spending, half a day or three-fourth your day the previous night on your Sunday, partying and or just having a good time, or doing whatever you feel is good for you, unless and until it's really required and you're reaching that burnout point, I would say focus on that assignment, right? Finish the assignment. I would always tell my students and my clients, one of the best ways is to avoid the procrastination is to do the work and then have fun. So if you have an assignment on the 16th and the submission is on, let's say, the 20th, I would go back home, finish my assignment on the 16th, and so then have my 17th, 18th, and 19th and 20th free. And I'd be happy in those days saying, hey, I finished. And at the same time, I do have leisure as well. So I think it's really about how you balance your time and how you manage that. Yeah, thank you. I hope that answers your question.
Yeah, hopefully answer the questions. So we have another question from online. So
Sure.
his name is her name is Ne'mah Musagia. She's
Okay.
from the Bachelor of Nursing
Okay.
in the fourth grade semesters. And she asked, what is the role of health workers in overcoming the problem experienced by the strawberry generations, such as giving up easily, aspiring, having high hopes but ambition that are easily broken, only wanting instant result without requiring heavy effort. I think this is the most problem for our generation, and whether the habits experienced by these generations can be resolved through medical and educational interventions so that they can change. Yeah.
I think one of the things that we as a generation need to grow with is the lack of patience. It's something that's so important to us because we don't give enough of time to understand our body and our mind with the challenge that we have at hand. Right? We give up so easily without having to try different ways of coping with the situation. Right? But with that said, I think we are a very democratic and a very, forthcoming generation where we do not want to take any kind of injustice. We want justice. And so even if it means that we would like to, find better ways of having to do get money in at bulk, but give short amount of time. And I see that happening a lot in the growing generation, which I have no issues with. I think it's just important for us to identify the kind of human being we are being in our society. Right? What are we possessing as a person in our society? So, I would say having to, navigate through this, one of the best ways to do it is to be able to try different ways of coping with the situation and or finding the balance in this situation, right? Having to give up easy. If you feel like this is not the field for you, no one's stopping you from being in it. You can find whatever is best for you. But if you're in it, then be in it for its truest self. I started off as a kid thinking I'll be a nurse, a BSc nurse. And then 12th grade happened, and I realized that at the sight of blood, I faint. I can't do it. Like every time I see blood, I just pass out. And so then I realized, like, maybe this is not for me. It's really not for me. So what can I do next? And I always knew that my passion was always to heal somebody, which was one of the reasons why I chose BSc nursing as a child, right? I didn't know better the field of psychology back then to want to know it or to be a psychologist at such a young age. It was much later I was introduced into the subject, and I said, yes, this is where I see myself being, because I still want to serve the society in whatever way I can and give to the society, and still work towards healing. So here is a lesser version of me having to see blood every day, but at the same time, I'm still working with pain and or different challenges people are going through in their life and helping them navigate through that. And I can't but emphasize how much I love my profession. So if you don't find love and compassion in the profession that you are doing, then no one's stopping you from having to find what you like. So don't be bound to something that you don't think floats your boat. Be true and honest with yourself. I think that's very important. So I wish you take this with you and be who you want to be.
Okay, thank you. Hopefully I answer the questions. And once more, I think who is the most responsible persons? Yeah, because you discussed about the ethics in the workplace. Yeah, ethics of health workers. So who is the most responsible person to maintain, the ethics keep on going, keep on the track, and in other side, without interfere with others protocol or others issue. What I mean is who is the responsible person to maintain, because in the workplace many of workers there, and we cannot depend on the one person. So according to you, who is the most responsible person?
I think the most responsible person has to begin with you, with oneself. If you are true to yourself, then everyone in that community, if each and everyone is practicing it amongst themselves, then hey, you have a very safe space to be in. So I think the first ethical practice should start from oneself. But to also add on to that, in each workplace there is different committees and different kind of, for us we have a grievance cell, so the students can come and talk to them, and they can expect confidentiality, and we will be following the right protocol. And if you're asking who makes these protocols and who exactly creates these ethics, then it is a combined version of the brainstorm of particular institutions and or collaborations of whatever you're working with. Now, if it's a hospital, then the hospital will have its own set of rules. Who makes these rules? All the heads, the CEOs, the HR, the psychologists, and everything, and everyone come together, and it's a joint effort to create this protocol and or this ethical platform in which one needs to conduct themselves in that particular workplace and or workforce, right? For example, if you ask me who makes this ethics and all of that in the field of mental health, we do follow the ICD, the DSM, and also the APA. And the ICD is all, and DSM are all diagnostic tools, right? They're criterias in which each disorder and or each different intervention plans, not intervention plans, but I'm talking about what exactly the patient is going through to make the intervention plan. And the American Psychological Team, NHS, the National Health Services, all of them, the WHO, all of these people are who actually makes the ethics come to power with us having to follow them. But honestly speaking, for oneself to be carrying out these, you need to be honest with yourself. Yeah, you need to be ethical yourself first with having to follow these protocols. I don't know if this is what the question had it, but I kind of try to answer around it.
Okay, okay. Thank you, Ms. Sharon. Uh, once, the last one. Yeah.
No problem.
Yeah.
No problem.
This is from Apina, a specialist nurse at Hospital Brunei Darussalam. And she asked, how do I approach someone I think is struggling without making them feel uncomfortable? Yeah, that's
What a lovely question,
Yeah.
right? And this is perhaps a tool that I will leave you with, because not just this one, but there are many different ways of having to approach it. If you're a nurse and if it's information that you'd like to have the other person receive, maybe we need to first see if that's our duty and if it's okay for us to be able to tell the client that in the first place, right? Maybe it's the doctor's duty to be able to like sensitively break the news to, the patient or the client. But if we need to be telling someone something ourselves, one of the first things I would say is always be humble and always be polite. One of the best manners to introduce a difficult conversation, be like, hey, you know what? If it's a disagreement, see, the circumstances can be very different. But if it's a disagreement, for example, you can be like, hey, something really didn't sit well with me. It's something I wish to discuss with you. Can you please hold space for me to be able to discuss this with you? Right? If it is a nurse having to, comfort the patient in their discomfort, I think it's very important for us to also be able to ask them what they want instead of having to, just say what we think is right for them. So, asking your client, hey, is there anything that I can help you with? Do you want me to just sit here in silence, or do you wish for me to tell you a story? How exactly do you want me to be there for you? And trust me, most often the patient know what they want. They perhaps just say, hey, I just want some silence, but I don't mind you having to sit next to me, right? And if that's what they want, that's not too hard to give. You can just sit there in silence. Right now, if the patient says, I don't know, which is also one of the most classic answers we get, then you can reintroduce saying, hey, think about it. And if you have something in mind, I'm right here. You can call me. I'm happy to be there for you. Right. And if you know that it's awkward and things like that, you can even tell them, hey, you know what? I know this might be really difficult at this point in time. I'm not sure what you are experiencing, but if you wish to share, I'm sitting right here waiting and listening to you. So I think it's really important for us just to be available, for us to be curious, for us to allow them to know they have a safe space to come to. So this is one of the ways I would introduce uncomfortable situations or having to disclose uncomfortable information as well.
Thank
I
you.
hope that answers the
Thank
question.
you. Hopefully, answering the questions. So, I think our time is end, Ms. Sharon, and the next section is the presenting of the certificate, and we will present you the certificate online. Yeah, please, for the IT, present the certificate.
Yeah, Pak Eko. Certificate submission to Ms. Sharon Anthony by Pak Eko.
Yeah.
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 Thank you so much.
And then Pak Eko,
Thank you so much, Ms. Sharon, this is the certificate.
It was a
from,
pleasure having
international
to speak
seminar.
to this
Pak Eko,
audience. Thank you.
we will have a picture together with Miss Helen.
Yeah. So before you leave, would you like to stay a moment to take a picture online? Yeah. Please.
To everyone in the Zoom, please turn on your video. We will take a picture together with Miss Helen. Mas Jay, are you ready to take a picture from slide to slide? Okay. Okay. Cheers. Yes. And then to the next, please. Next. Yeah, Pak Jay? Okay, and then next. Okay, next. Yeah, next. Oh, okay. Thank you, Pak Eko.
Yeah. Thank you, Ms. Sharon.
Thank you so much for having me on this platform and for the opportunity.
Discussion. Yeah, thank you, thank you.
Take care.
Yeah, thank you. Okay, ladies and gentlemen, this is the end for the second agenda. For the next agenda, before we go to the next agenda, we have a presentation from Tapak Suci, please.
Yeah, everyone, great performance of traditional martial art, collaboration, the students of undergraduate program in physical education and regional board 39 Tapak Suci Putra Muhammadiyah. Give applause to them.
Indonesia is the most beautiful land in the universe. The land where we were born. The nation where we grew up. So many colors that live together in peace. With a million timeless treasures. With an abundance of natural wealth. Indonesia is not just wonderful. Indonesia is a wonderland. menyuarakan kemerdekaan Indonesia. Hal-hal yang mengenai pemindahan kekuasaan dan lain-lain diselenggarakan dengan cara seksama dan dalam tempo yang sesingkat-singkatnya. Jakarta, 17 Agustus 1945, atas nama bangsa Indonesia, Soekarno, Hatta.
Pak Eko, I give you back. Thank you.
Thank you. We are still in a mental health seminar in the health service in mental health and psychological aspects. So, for the next agenda is come from the third speaker by Dr. Hadijah with the title Psychological Approach to Health Services. For Dr. Hadijah, are you there?
Yes, I'm here.
Thank you. So, before she deliver the presentations, let me introduce her backgrounds. Yeah. Her name is Dr. Hadijah binti Haji Abdul Mukmin. She is a senior assistant professor and also research associate in the Center of Advanced Research Care, University of Brunei Darussalam. And there are too many to be mentioned for his awards and recognitions. I will mention one of them. She awarded a Research Excellence Award in Science for Senior Academic Research, University of Brunei Darussalam in 2023. And she obtained the medals in 2013 in state honorary medals as excellent service medals. And she also the member of the fellowships of NUS-SEA Research Fellowship Center for Aging Research and Education, took NUS Medical School, National University of Singapore. From May to November in 2024 for the 6 months. I want to reach all of the fellowships, and she also obtained the grant, from the Institute of Health Science Research grants, and the title project is Self-Care Practices Through Miscarriage Experience of the Women, their husband and nurse or midwife. And there are many grants she has, and for the publications, there are also so many publications that come out from her studies. One of them is the article with the title Usefulness of Antenatal Care Handbook, a cross-sectional study of mother perspective. Too many awards and also achievement from Dr. Hadijah. So without any delay for these seminars, I would like to Dr. Hadijah to present. Dr. Hadijah, time is yours.
Thank you so much. The sharing is from your side or from my side?
From Mr. Jaya, who will handle the, yeah.
It's from your side, yeah?
Yeah.
The sharing.
So, wait a moment. Oh.
Yeah. Yeah, well, we are waiting for the PowerPoint. Hello, everyone. Thank you so much for attending the conference, and thank you to the organizer for inviting me in this conference. Especially dedicated my thanks to our Dr. Huzayah. Yeah, I wish you success in your PhD in midwifery under the sponsorship of University of Brunei Darussalam. Right, thank you so much, everyone. So today I'm tasked to talk about mental well-being using the psychological strategies. And thank you so much for the introduction. And yes, I'm a senior assistant professor in Institute of Health Science, and I'm also a research associate in the Center for Advanced Research in UBD. And at the same time, I'm also an adjunct senior lecturer in a School of Nursing, Latrobe University, and as well as research fellow at INTI International University, Malaysia. Currently, I serve as an expert in aging research at the ASEAN Center for Aging Research and Innovation. Right, so let's move on to the next one. Next slide. So when we work in the clinical setting, we have expectations, but the reality that we are facing are different. So today we are going to talk about how are we going to implement psychological strategies based on, I think most of the things that I share with you in this slide, itu ya Bapak dan Ibu-Ibu, saya boleh ngomong dalam bahasa Upin Ipin nggak? Dan juga combine with English, ya? Boleh ya?
Boleh.
Okay. So yeah, so as you can see here, expectation and reality are different. So my sharing will be according to what I experience, pengalaman saya ya di clinical, dan juga pengalaman saya dalam membuat riset di bagian ini juga. So all my research experience and what I have found from my research, I will share it in this presentation today. Okay, next one. So working at the healthcare service, there are many expectations. So one of the things that we are going to talk today is common issues. What are the mechanisms to address these common issues? What are the challenges? And finally, we will talk about the take-home messages. Next one. So the first common issues are staffing, by which we're going to talk about the nurse-patient ratio. Sometimes staffing is concerned with how many nurse or how many healthcare professional. I understand that this conference is attended by pharmacists, as well as nurse, midwife, all the different health sciences students, yeah? So when we work in the clinical setting, there are problems with staffing. Usually the problem is a concern with the ratio by which the number of healthcare professionals and the number of patients are not tallied, okay? The nurses are lesser than the number of patients. Patients are much more than the number of healthcare professionals. The second thing about staffing is related to knowledge, attitude, and skills, right? So the problem with knowledge, attitude, and skills are some staff are not able to deliver what they are supposed. They are not able to deliver the provision of care because they don't have the attitude, they don't have the right knowledge, and they don't have the right skills. The second common issues are the workload. Okay, the workload are concerning about the pressure of time sometimes. Okay, especially those who are working in intensive or high dependency areas, they are usually faced with having to address the provision of care in the limited amount of time provided. Ya, kayaknya kadang-kadang kita bekerja kalau di tempat di klinikal itu ya, especially di tempat darurat ya. Dan kecelakaan ya di sana mungkin masanya itu terlalu sedikit untuk kita lebih efisien ataupun lebih cepat untuk bertindak sebab masa itu adalah emas kalau di waktu di tempat-tempat sebegitu ya. And again there is also problem with issues on there are a lot of workload that have to be handled by healthcare professionals in terms of we don't have enough staffing. Okay. Another thing is team dynamics. Okay, team dynamics, there are many different things about the team dynamic. First is cohesiveness, cooperation, and communication. So, di dalam bekerja sebagai satu tim itu, kita memerlukan satu kerjasama yang mantap dan juga komunikasi yang efisien. Ya, dan juga semangat setia kawan dan satu tim yang bekerja sama antara satu dengan yang lain. So, the team dynamics are very important. It's because if you don't have that, then you can't work properly. Okay, then it will cause you stress. So all the staffing, the workload, the team dynamics, it will cause you stress. And if you are too stressed, then you become burnt out. Then you can't come to work. You are going to have medical certificate, sick leave. You know. Another important thing in this digital era is complaints. Okay, there are complaints about the staff from the public or the staff from the staff themselves, but the channel of communications are wrongly used. Okay, nowadays we have Instagram, we have Facebook, we have WhatsApp. So then when you do something wrong, it will become viral. Okay, so the common issues there are we have complaints, but we do not. It is not delivered at the proper channel. Ya, kalau di Indonesia itu sama dengan di Brunei ya. Kalau ada komplain daripada publik, orang ramai, halayak ramai, dan juga daripada staff-staff antara kita, mungkin ada kalanya ia viral, menjadi viral di WhatsApp ataupun di Facebook ataupun di Instagram. Ada kalanya di TikTok. Jadi kita menjadi famous dengan negative way. Ya, we are famous in a negative way. So, mungkin channel tempat meluahkan rasa tidak puas hati itu adalah salah. Okay, the correct channel for delivering the complaints are yet to be identified. Okay, next. So, the mechanisms are through, first is the welfare. In Brunei, before I go too far, I would like to wish all the nurses and all the midwives happy International Day of the Midwife and happy International Nurses Day. So yesterday, our minister, on Monday, our Minister of Health, Yang Berhormat Datuk Seri Setia Awang Haji Isham, mentioned about the 4 important things. First is the welfare. Second is the continuous professional development. The third one is workplace health and safety. And the last one is self-care and resilience. So these are what I'm going to talk here. So basically, whatever his speech, I have wrapped it up into these 4 things. And I believe this also apply in Indonesia and in Thailand, in Philippines, in India, in Malaysia, in Singapore, in wherever you are. So it is most important for the psychological strategies to take care of the welfare of the nurses and all the healthcare professionals, not only the nurses, but all healthcare professionals, especially nurses, because they are 80%, or sometimes in other countries it's 90% backbone of the healthcare system, right? So it is important to take care of the welfare, because if they don't feel that they are treated well, then they are not going to perform. Okay, so that again come into the common issues with burnout and also stress. CPD is continuous professional development. We are just now I mentioned about the knowledge, the attitude, the skills. If they don't have continuous professional development, meaning a continuity in education. Jika terhenti pembelajarannya hingga untuk semasa graduasi saja, makanya mereka nggak ada cara untuk update ilmu mereka ya. Jadi kalau nggak ada CPD itu berarti nanti kita tak tahu apa yang terjadi di luar sana. Sebab kan healthcare professions are dynamics, they change. Every time and then they change. Every time and then there are new trends, new machines, new care, new research, new evidence. So continuing professional development is very important. The next one is workplace health and safety. Workplace health and safety is very important in such a way that we need to maintain the welfare of the staff in terms of they are working in the right environment with the right instruments. Imagine, in countries like Africa, we always read it, from journals that they don't have a lot of resources, that they have to maximize whatever they have, and sometimes they have to improvise whatever they have. So, as far as possible, I know that sometimes we have to do that. In Brunei, we also have to do that sometimes. But if possible, resources must be adequate and must be appropriate, must be working in the right resources for the right setting, clinical setting. And lastly, all these things, if you have counseling, for example, if you have a counseling section, ya, jika kita memerlukan counseling, mungkin ada departemen counseling gitu, ya. Tapi kan kalau semua ini ada, semuanya telah diaturkan, tapi kita sendiri nggak menjaga diri kita sendiri, makanya kita nggak akan resilient. We are not going to bertahan ya di dalam pekerjaan kita sebagai seorang healthcare professional. So what I'm trying to say here is self-care and resilience are very important. You need to have your own self-mechanism. How are you going to take care of yourself, and how are you going to be persevere throughout your work as a healthcare professional? Because healthcare professions are very challenging. You are going to face with your customer or consumer or the patients every single day, and they have diverse background with diverse complaints and with diverse attitudes. Right? Next one. So we need to make sure that our workforce are job ready. What job ready means? Job ready means they are skillful, they have critical thinking, they use research and evidence to inform their practice, they have global skill, and lastly, they need to be an independent practitioner. So, next one. So all these skills are very important, but aside from all the skills that we have for our clinical setting, what are other things that we need to have? We need to have the soft skills, okay? We need to be dynamic. Dynamic means, as I said earlier, healthcare professions keep changing, yeah? We have new evidence. Every day we have new evidence. If we are not up to date with the knowledge and with the skills, with the current research, we don't know what's happening out there and what's good and what not. We are not going to provide care based on our routine. Okay, we are supposed to be providing care based on current evidence and current research. So we need to be dynamic. We need to be adaptable. Adaptable means, you remember during COVID-19? Yeah, when we have to be adaptable to the situation, we work from home, patients can be going to the hospital in a large number, okay, so that's adaptable. Responsive is very important, like a chameleon. If you go inside, if you are mingling around with different kind of people, then you change your attitude and you change your way of talking, okay. If we can reflect back from Professor Sharon sharing just now, yeah, it's important for us to be humble, to be responsive, and to be able to work as a team with different people who are coming from different background and who age differently from each other. So most important is we persevere. Whatever challenges facing us, we persevere. Of course, sometimes we have negative thinking, that's normal. But sometimes after 2-3 days, we become positive again and we learn from our experience. Most important is we learn from our experience, then we become resilient. Okay? So we don't want to take all the thing negatively, then it can affect us and it can make us burn out and it can make us wanting to quit our job. Yeah? And that's normal. Yeah, wanting to quit from our job, wanting to move to another place is normal. But what we want is resilience in terms of self-caring ourselves. Next one. So challenges are also related to expectations and reality. Next. So sometimes it is very difficult to be adaptable and we are not responsive and not dynamic. That will make us easy to give up and easily frustrated, and we become weak, we become shy, we don't want to mingle around with people, we becoming more anxious, do a lot of thinking, ignorant, and lastly we become negative thinker and we have adverse mental effect. Yeah, so it is very important for us to have those skills and to have that self-care so that we are able to take care of ourselves. As a carer, we care for others, but who care for us if not us? Okay, next. So what are the reasons of the challenges? What are the reasons of we having a lot of psychological problems in terms of stress? We cannot cope with stress. We are burnt out. What are the reasons? So let's see some of the reasons. Next one. So the first one, what we can see nowadays are generation gap. In this world, during the current state, we have a lot of healthcare professionals who are aged differently. We have 20 years old who are working as a nurse. We have 30 years old, we have 40 years old, we have 50, and we even have 60 and more. So we have a lot of generation. So all these generation have different attitudes, different habits, different expectations. So that is why we have a gap. Next. Next one. So these are some of the example, although I think it's not a good idea to label people according to their generation. And as you can see there, we have a generation Alpha coming, but in most research studies, they now call this generation Alpha as generation AI, generation artificial intelligence, yeah, because they do all the work using AI. Okay, and don't get blurred by what they write, because they use AI most of the time and with what they created. So yeah, it's just because three of my sons, I got three sons and a daughter who are in the generation AI, generation Alpha, and they do a lot of beautiful presentation, and they said that my presentation are very dull. Anyway, okay, next one. So let's move on. Let's move on. So in the work setting, we have people who have different qualification. Okay, umpamanya kalau perawat itu atau bidan itu mereka ada berbagai-bagai ya, diploma 1, diploma 2 gitu, diploma 3 ya. So it's different. People coming with different level of diploma or different degree, or even sometimes they are coming from different institutions but working at the same place. So sometimes they are coming from private sectors, private education provider. Sometimes they're coming from public sectors, from universities, from schools. So because of that, there are stigma. Okay. We tend to label people who are coming from certain institute not to have a good quality of education and not good skills. I understand in Indonesia, because I'm always invited for your assessment. kan di Indonesia itu mereka ada accreditation, ya. Every year you have this accreditation things going on, and you have to be accredited, and dia akan di label ya. Seperti level 1, 2, 3, I can't remember how it is labeled. So sometimes this also affect the stigma, okay? And people tend to compare and it become a discriminating behavior in the hospital. And again, like us in Brunei, I'm not quite sure in India, but in Brunei and also Malaysia, I believe we have expatriates as well who coming from other countries. Doctors, nurses, and other healthcare professionals who come from the Philippines, who come from the European country, who come from India, who come from other countries, basically. Yeah. So we have different expectation from these different people, and sometimes it causes stigma. Next one. And this will make the workplace as unhealthy. And this has to be broken. It is easier for us to say, we have been doing and tackling it, but it still persists. Next. So we need to ensure equity. Okay, we can't treat people equally, but we can treat people with equity. Okay, if you treat people equally, that's what you get, where, people can see the softball, because everyone is given equal stool. Okay, but if you talk about equity, everyone will have same treatment. Yeah. Next one. So, bagaimana caranya kita untuk mewujudkan psychological strategy, psychological aspect of health adalah melalui support system psychosocial, ya. So, psychosocial support is very important because the nurses, the midwife, the pharmacists, the occupational therapists, the doctors, whoever the healthcare professionals are, they need to turn to someone when they feel that they are in a certain condition by which they can't cope. So the most important support that identified from our research is family support. Okay, so they need to have family so that they can talk to the family, because family are the most, orang yang paling berrahasia, ya. Enggak ada akan terbuka rahasianya kalau dengan family, right? So family are the most secretive group of people, so they can just say whatever they wanted to the family. Friend is also very important. If you have a good circle of friend, but be careful to choose friend, because sometimes friend can be, have different faces into different side of your face. So again, we come to the family. Family is the closest one. Friend can be good as well, but you need to really have choose good friends. Yeah. Workplace environment has to be conducive. You have to have employer support, by which you need to have a mechanism. For example, kayaknya mesti ada counseling, ya, counseling service, ataupun cara untuk bagaimana kita, kalau nggak puas hati, bagaimana kita, kemana kita pergi. Yeah, so in a simplest way, we healthcare professionals, they have their boss, so they have to talk to their direct boss, and then the boss have to talk to the boss, and the boss, and the boss, until whatever the situation is. Okay, we also have counseling section, welfare section, if we have that in your clinical setting. And most important nowadays, people have online network support. I find network support very important, especially when I, just a little bit about my other side, my dark side. When I have miscarriage, I like to go online because I wanted to see what other miscarriage mother experience. Okay, so similarly, there are also network support on healthcare professionals out there who can help each other, who can support us throughout our good and bad times. Next one. So soft skills inculcation is very important. We need to socialize due to the different ages. Again, coming back to Professor Sharon presentation and the other presenters before me, socialization is very important because it helps to build team building. You can't speak the way you speak with a 20 years old to a 40 years old, and similarly the same. You can't speak with a 20 years old in the way you speak to a 40 years old. So, these soft skills are very important. Next. What are the take-home message from this presentation? Next one. So you need to change. We need to change. If you change nothing, nothing will change. If you go to the changing room, you bring the clothes, then you go out. If you don't change it, then nothing will change. So similarly, we are sitting down here today listening to this presentation and the other brilliant presentations from the other presenters. I am sure that they have brilliant presentations. But if we don't make a change, then nothing will change. Yeah? Next. So you see this one? Okay, don't press anything else. Then I have to talk about both. Then it's not it's not surprise anymore. Anyway, so you look at the first love there. The first love at the hair, you can see a young woman. Okay. The second love down there at the white there, you can see an old woman. Can you see it? Okay. So when you first see this photo, which one do you see? The old lady or the young lady? Okay. With the next photo, we see a grumpy-ness. But actually, if you turn it upside down, this nurse is actually smiling. Okay, so what's the message there? Next one. The message is, when you change the way you look at things, the things you look at will change. Okay, so meaning, if you do self-care, you take care of yourself, you try to persevere, you know where to go to when you have psychological change, psychological effect, you have burnout, you have stress, then you yourself will change. Okay? So you have to change the way you look at things so that the things you look at will be changing as well. Next one. So again, coming to this, now I want you to do it fast. So communication, self-motivation, leadership, responsibility, teamwork, problem-solving, decisiveness, ability to work under pressure, flexibility, negotiation and conflict resolution. All these are skills that does not come in one day. These skills can be learned when you are in the university. So take the opportunity to tick box this thing. If you don't have all these tick box, that means you have to really work hard. Okay? Communication is very important. As I said earlier, we have a lot of people who are working with us with among different ages. Ya, kita bekerja dengan berbagai orang di berbagai umur. Ya, ada yang senior, ada yang muda. Jadi kita harus bekerja sebagai satu tim. Dan kita perlu memotivasikan diri kita sendiri. Sebab kita nggak boleh berharap saja kepada bos kita. Bos kita ada beribu-ribu orang yang perlu dijaganya. Kalau kita nggak jaga diri kita sendiri, makanya kita akan tewas. Okay? Leadership is very important. Kepimpinan dan pengurusan juga ada sangat penting. Di mana kita sebagai diri sendiri, kita mengurus diri kita, mengurus keluarga kita, dan juga mengurus di tempat kerja. Okay? Leadership is not only about the ability to manage things and the ability to become a role model, but whether you yourself portraying a good model, because people are looking at you and they will duplicate you. If you give a bad example, then people will give you a bad example as well. Okay, responsibility is very important, and commitment. We need to have commitment. We need to be responsible so that our healthcare systems are very strong and are psychologically strong. Okay. Negotiation and conflict resolution is also very important. Kita mesti ada skill itu ya, skill yang dapat negotiation, kita dapat menyelesaikan konflik. tidak semestinya menyelesaikan dengan menyelesaikan masalahnya, tapi mencari cara untuk menyelesaikannya dengan cara yang terbaik. Okay, menyelesaikan masalah dengan bagus. Ya, problem solving, negotiation, and conflict resolutions are very important in healthcare professions. Next one. So we need to stop the stigma, stop comparing and competing. We need to work as a team. We trust each other, inspire each other, exchange knowledge, assisting each other, supporting each other, sharing whatever we have with others so that we can be successful together. So this is what we call as collaboration. Next one. And survival skills are very important. We keep learning and improve ourselves. Keep educating ourselves because we are from different healthcare professional, different healthcare system, and different healthcare environment. So never stop learning so that you will survive. Okay, survival is not a one day. It will keep growing and growing once you are in the system for a long time. 1 year, you might feeling strong. 2 years, you will becoming more stronger. 10 years, you are going to become much more stronger, and so on. Okay, it will be growing through times. Next one. So self-care inculcations are very important. Talk to yourself. What do you want to do? What can you do to actually relieve yourself from the pressure? From our studies during COVID-19, there are people who likes to do physical activities, hiking, yeah, to actually relieve their stress. There are people who likes to do jogging, brisk walking, but there are also people who like to do writing, make journals, write diaries, write books, write poems. There are also people who likes to come back to God, to their Creator, come back to Allah. Okay, because when you talk back to Allah, then you feel better. Because there is no other way how you make feel better except to your Creator. Next one. So mindfulness is also very important. Do deep breathing exercise. There are many deep breathing exercise in YouTube. You can always access them, and it helps you to reduce your stress, relieve your anxiety, and reduce depression and so forth. Next one. Religious and spiritual practice, as I mentioned earlier, from being a Muslim, a Christian, a Buddhist, and so forth. So you can come back to your faith and practice spiritual practice and religious practice so that it will make us strengthen not only from the outside, it will strengthen our inside. Okay, next one. Life skills are very important. I get this from National University of Singapore. When I was in Singapore for 6 months, I was taught the life skills by which we need to become very innovating, an innovative person. We always have to be curious and do independent learning. Don't depend on others. Don't depend on your boss to send you to learn. You have to find ways to learn. Use your critical thinking. Make things positive. Don't always think negative. What are the global perspective? How do we communicate and engage with others? Collaboration with others, and realizing our responsibility and giving back to the community, the nation, and the world. And also, we have expertise in many areas. Digital literacy is becoming more important nowadays, especially in nursing, midwifery, and healthcare. We have health informatics. If you are behind health informatics, then you are going to be left behind. Personal values and professional ethics are very important, as Professor Sharon mentioned just now. Self-awareness and mental resilience, and as well as personal effectiveness. Next one. So again, as I mentioned earlier, perseverance is very important. Stay strong. Don't give up. Okay. I think on the 12th, during the 12th of May, I give talk about success story, but I apologize to them. I'm talking about research. So for those of you who are from Brunei, today we are going solely about research and educating you all in from the academic perspectives. Next one. So for the education setting, we need to create a curriculum by which it provides the healthcare professions with the right knowledge and also with the right attitude and skills. Sometimes we can provide the knowledge, we can provide the skills, but the attitude bit we are lacking. Okay, students are intelligent, they can perform work perfectly well, but their attitude, their mentality, and how they deal with others are depleting each day. So these are the things that we need to consider. Next. So I think with that, I end up my presentation. I hope it has been a good one. Ya, saya mengharapkan agar Anda semua dapat manfaat daripada my talk. Ya, so sekarang saya bukakan lah ya untuk sesi soal jawab. Ya, makasih. Thank you very much, Madam.
Thank you, Dr. Hadijah. Please give big applause to Dr. Hadijah from Brunei Darussalam. Okay. Now the next section, discussion sections. Anyone? Raise questions, please. Okay. Or in the online room, can leave a comment in the message box. Yeah. Yeah, like previous speakers, just to trigger others have questions. Yeah. You mentioned that in the slides we have the same. It is different, equality and equity. Yes. Could you give an example in practice context, especially in nursing or in midwifery?
Yeah. Yes, fantastic. That's a very fantastic questions, Mr. Moderator. Yeah, I can give you example of, say for example, an underprivileged patient come to the hospital. No, sorry. Let me put it in the reverse situation. A rich person come to the hospital, so he doesn't want to eat whatever you give in the hospital because he is used to eat lavish food. Okay, and he when you give advice to him, if he come to the hospital, you will of course give advice about nutrition in terms of, okay, you need a lot of protein, you need to eat chicken, you need to take fish, you need to take broccoli. But what if an underprivileged patient come to the hospital? Will you also say, you eat broccoli? How much is broccoli costing to him? Then you also said to him, you eat chicken, you eat meat. But in fact, they can't buy even chicken or meat. All that they can buy are eggs. So this is what we meant by equity. If you treat them equally, then you are going to give them equal advice. But if you talk about equity, then you are going to provide care according to person-centered, individualized care, and holistic care. Thank you. I hope I have answered the question.
Okay, thank you, Dr. Hadijah. Okay, any questions? Yeah, we have questions from the offline room.
Yeah.
Okay, please mention your names, where you from.
Boleh saja dalam bahasa ya, kalau nggak mau dalam bahasa
If it's
Inggris.
difficult to say in English, just in bahasa.
Hello, Miss Khadijah. I like to introduce myself. My name is Risna Noval. I am a graduate student from University Muhammadiyah Pekajangan, Pekalongan, study program physiotherapy, and my question is, in today's fast-changing world, how can individual cultivate a never-stop learning mindset to stay relevant, adaptable, and continuously grow both personally and professionally. Thank you.
Thank you. So the question is, in this dynamic world, how can we keep on learning? Is that is that it? Right. So it's very important as healthcare professionals. It is very important for us to keep up to date with ourselves because the care might be changing, and not only the care might be changing, it's also new evidence. There are also new evidence. There are also new needs, and it's just keep changing every time. So, for example, I give you an example of in terms of occupational. I don't know whether it relates. I can give example on podiatry. I'm conducting a study on peripheral arterial diseases and its relationship to diabetes, whether a diabetes patient can feel pain and can identify that they have gangrene at the earliest stage before gangrene even occurs. So previously we are not concerned about this, but because of the high number of people who are being amputated, then it becomes important for us to learn what are the correct method, what are the correct provision of care to this patient. Okay, that's one example. The second example is related to technology. Okay, in occupational therapy, we have a lot of new technology nowadays which are being used. So when you work at the hospital, for example, and then in one day, for example, we have a machine which is new. We don't want to, when the machine come, then barulah kita nak learning. Kita nggak mau gitu. Kita mau kita sudah terdahulu daripada apa yang sudah terjadi itu. Dia memang tidak mudah. Dia tak mudah. Jadi makanya di sini message-nya adalah jika kita hendak sentiasa ingin belajar, kita hendaklah menanamkan dalam diri kita satu komitmen, satu rasa tanggung jawab bahawa kita sentiasa ingin maju ke depan. Jika tidak kita buat begitu, maka ia akan mengakibatkan kualiti penjagaan yang menurun. Jadi again it comes to responsibility, your global citizen responsibility. Okay, your passion in improving your skills, in providing quality of care to each and every one of the patients, regardless of their background, regardless of whether they are rich or poor. So we want to give, as I mentioned earlier, equity, to the care that we are giving. Rizky, what?
Hopefully answer the questions. Okay. Anyone have other questions?
Boleh bahasa? Saya
boleh
okey.
bahasa.
Saya okey.
Boleh bahasa, it's okay. Please, in front. Someone, could you bring the microphone? We have one questions from students.
Hello, Ms. Khadijah. Let me introduce myself first. Okay, my name is Talita Rahmadinda, as a midwife undergraduate. Miss, a few of their patients who suffer from PTSD often experience panic attacks when in public place. So, how can we as healthcare professionals can help patients develop coping skills to manage stress and hurt triggers? Thank you.
Right, so this is the students manage stress or the patient manage stress or the woman?
The patients. Patient manage stress.
All right, good. Okay, very good questions. I do not do study on postnatal depression and postnatal blues and anxiety so far, but I did studies on miscarriage, 2 grants on miscarriage. What we found from the woman, which might be similar, but I think it is similar in a way because for miscarriage woman, they are expecting the baby and then suddenly they lose it, and then they don't know whether they are going to be pregnant again, and even if with repeated miscarriage, they also feel that they are unequipped. They are not fully tidak menjadi ibu yang sepenuhnya, ya, sebab mereka nggak dapat mengandung dan mereka nggak dapat mengandung lagi jika ada recurrent miscarriage. So I think this also cause anxiety. So if I can relate that to the postnatal depression is usually because we don't tackle the physical bit. Okay, postnatal depression, postnatal blues, postnatal depression, and all the other postnatal mental health are usually caused by physical activities, which are not, the changes in their daily life. So, jadi jika mereka itu menghadapi panic attack, ya itu berarti kita, bentar ya, saya nggak nampak semua, jadi saya nggak suka kalau saya nggak nampak semua. Ya, so berarti kita perlu mengajar mereka cara penjagaan diri. Ya. Kalau semasa panic attack itu, the only thing that we can do is to ask them to pause, deep breathing exercise, deep breathing aja. Ya, tarik nafas dulu. Saya tahu kamu sedang di dalam keadaan panik. You have a deep breathing, and then ask them to pause. Just pause and forget about everything. Ya, then but you have to reassure them. We are here. Kan kita selalunya kalau di Brunei kayaknya we do postnatal nursing home. Yeah, we go to the home, we provide care to the woman at home. So, but when we do the home visit, there are actually about 2 or 3 midwives who are going together. So what we can do is one of you can take care of the woman by implementing the deep breathing. Ask them just to stop thinking about anything else, and just to stop and just think about the breathing. Okay, but at the same time, because no other thing that a midwife can do except for calling for medical advice, right? Because we don't have, aside from counseling, of course you will do counseling when you do the deep breathing exercise. Of course you are going to do counseling. You ask them to talk. You listen. Okay, when we listen, we use our counseling skills. Do not say, "Oh yes, I understand." You cannot say that, because then she will say, "How do you understand? You are not in my position," right? So probably we can change some of the words that we use, like yes, we can feel you. I can see what you are feeling now, and just keep them letting out what they are panicking about, what they are worried about. It is important for midwives to listen during this time. Okay, what sometimes occurs is we as midwives, we don't listen, but we tell them, "Oh, from my experience, you jangan buat begitulah. Saya dulu semasa saya mengandung, saya tak begitu. Tak boleh begitu." Because this is what we see sometimes speaking. Not only midwife, also nurses and other healthcare professions. We always tell the patients about our experience. When our patient talk to us about their experience, we tend to compare. We tend to stigmatize them for not being able to cope. Yeah, so I think that's about it. Most important, if you do home visit, make sure that you are not alone. Take another person, at least 2%. One person can take care about the breathing. Another one can talk about what are the things that make the woman panic. Yeah. And then just let them out, and keep deep breathing exercise until the woman feel at ease. If you can't stop them from being panicked, then you have to call for medical advice. So I think as simple as that, but although it is not easy and not as simple as what I say, but at least we can try something out of nothing. Yeah. Right. Thank you.
Thank you. Hopefully answer the questions. We have a question from online room. Yeah, the question from Nur Intan Kusuma. She asks, I would like to ask about how to promote self-care for pregnancy and postpartum mother in run area, especially mentally, as we know that during that period mothers can be more sensitive, especially if their environment do not. Yeah.
Yes. So in what environment? Rural area? Is it rural?
Rural area. Yeah.
Rural area.
Yes.
Okay. That is very important. Yeah, the question is very important. How do we instill self-care, especially for women who are in the rural area where they can't access all the time to healthcare system? Yeah, that's what the question is. Yeah.
Yes.
Is that okay? So yeah, this is very important. From our findings of the study, I did a study on spiritual needs of women in the postnatal care. We haven't report the qualitative aspect, but from our findings, we find that they don't find antenatal education working 100%. So if you teach self-care during antenatal period, that self-care may be good for pregnancy itself. If you want to teach about postnatal, then they said that it's good if this is done during the last 2 months before, not even the final trimester, but the last 2 months before they give birth. Then you can teach them self-care, then they can use this self-care. But I also found from my friend, saya nggak ingat ya, in one of the presentation that I make during the conference in Indonesia, ada satu grup orang asli yang mereka beranak sendiri di dalam hutan. Jadi mereka itu kayaknya self-care-nya is very strong. Ya, because bila mereka mau melahirkan, mereka perlu pergi jauh daripada orang ramai sebab mereka diperlukan untuk mandiri. Jadi mereka pergi ke hutan dan melahirkan anaknya sendiri di dalam hutan. Jadi when I talk about self-care to this group of at the university, they said that I think in Indonesia, especially in rural area, we do not take for granted that their self-care is actually very strong than those in the urban areas and those in the city center. So all that we can do is to emphasize apakah what are the self-care that they have done, and we can strengthen it with whatever they don't have. Okay, the first one is spiritual self-care. Spiritual self-care is very important because this is the time that they talk to Allah, talk to their their creator, talk to their higher being, their supreme being. That's the most important. The second thing is physical care. Physical care is taking care of ourselves. So physical and spiritual, you can actually separate that. It is together because without mental health, there is no health. And as well as without physical health, there is no mental health. So you have to have both, because if you are good mentally, but you cannot take care of yourself, also not good, then you are good physically, but you can't take of your mental health, then it's not good as well. So berarti di sana kita satu is the spiritual care, yang kedua is the physical care, and yang ketiga dia perlu memahami what happens in the 3 trimesters. So we need to give them the knowledge on the process of childbirth from pregnancy kepada melahirkan anak, and also during the postnatal period. So these 3 periods are very important. They need to have sufficient knowledge on that. Jika ada leaflet yang bergambar lagi lebih baik. Ya, ada kalanya mereka ini nggak pandai membaca kan. Jadi kalau ada leaflet yang bergambar, infografik lagi bagus kepada mereka. Tapi kalau mereka pandai membaca lagi bagus kalau dikasihkan dengan informasi di dalam leaflet tersebut. I think itu adalah sedikit sebanyak. Ya, I'm aware of the time. So I think I hope I have answered the questions. But one thing that I want to emphasize here, don't take for granted people who live in the rural area. In fact, I think they are the most strong in their self-care. Thank you.
Thank you, Dr. Hadijah. hopefully answer the questions. So I think our time is end, Dr. Hadisa, and this is the last section for our agenda, the third agenda, and the next section is the presenting the certificate. Yeah, please, Ms. Ais.
Yeah, Pak Eko, we will have a certificate submission. Please, Pak Jai. Okay, Pak Eko.
Yeah.
Yeah.
Yeah,
Gi-
certificate
give
for
applause,
Dr. Hadisa.
everyone.
Yeah, please give big applause for Dr. Hadisa. Thank you, thank you.
Pak Eko, wait a minute. We have a picture with Dr. Hadiza in
Yeah.
a screen.
Before you leave, I would like you to invite to take a picture for us. Please open your camera. Yeah.
Okay. Yeah. Cheese. Pak Jai. Yeah. And then next. Oh, okay. Okay, Pak Eko. Thank you very much.
Thank you, Dr. Hadja. Once again, thank you from Indonesia. Thank you. And once more, give big applause for Dr. Hadja.
Thank you so much, everyone, and I'll see you, the management team at 2:30 Brunei. Yeah.
Yeah. Okay.
Okay. See you all. Bye then.
Thank you. See you. Bye bye. The next agenda is the last agenda. Come from Dr. Tukumin, who will deliver the topic cultural psychological based health service approach. Yeah. Dr. Tukimin, are you there? So,
Yeah.
Yeah. Okay.
Assalamualaikum.
Waalaikumsalam.
Good afternoon, all of you.
Yeah. Thank you. So, this is the last agenda for our today's seminar with the topic cultural psychological based health service approach. Before Dr. Kumin deliver the presentation, I will show you the background. Yeah. His educations from 2017 to 2021, he holds Doctor of Philosophy in Health Sciences, PhD in Health Science, and he holds the Master of Science in Nursing in Northumbria University, United Kingdom, and also he holds the Master in Public Health in Diponegoro University, Indonesia in 2022. Yeah. His works experience, too many to be mentioned, you can see on the slides. Yeah. Okay, Dr. Tukimin, you can start your presentation. Dr. Tukimin, time is yours.
Yes, Assalamualaikum warahmatullahi wabarakatuh, and
Waalaikumsalam.
good morning to all of you. Respected to the Dean, Faculty of Health Science, University Muhammadiyah Pekalongan, then the organizing committee, then lecturers, yeah, and speakers, yeah, then our beloved student, yeah, and MC also, yeah. Thanks for the opportunity. Yeah. Okay, I would like to present. Yeah. Okay. Actually, what I maybe also associate with the previous topic. Yeah. Actually, our topic is. Can you go to the slide, please? Hello. First slide, please. Okay. Actually, our presentation, yeah, address for practice development. Yeah, practice development. Yeah, in the mental health services. Yeah. Okay. when we talk about the practice development, we have to understand the trend, and its issues. We know that recent trend of the healthcare profession is actually patient-centered care. I mean, we have to orient, we have to more focus to our patient rather than only our team. However, we have to provide everything for patient. Then the practice development will the importance. Concept. Actually, we recognize we call it as the evidence-based practice. Evidence-based practice. So now later we will maybe pull out from the evidence-based practice about the culture. Why culture? Actually, when we want to develop the practice, using the evidence-based practice, we have to integrate. We have to integrate the best research evidence, clinical expertise, and patient value and preference. Patient value and preference. So we have to highlight that patient value and preference. Patient value and preference, this include social culture value and belief of the patient. Accordingly, WHO also recommend to integrate the service not only focus to the modern, but we have to consider we call it as the alternative and maybe the complementary. We recognize the two terms, alternative or complementary. But in this context, the development of the practice in the service of the mental health actually more to complement or to integrate and not to replace. Using the culture. Okay, our topic actually more to how the culture actually influence the practice, or maybe we can consider, we can incorporate actually the culture into practice. This is our presentation aim and scope. We attempt to foster the understanding about the culture and mental health services, and then develop comprehensive understanding of the culture-based mental health services. Then the aim, explore diverse approaches in the mental health, to examine various culture contexts that shape a mental health care delivery, because in nature, patient life in the original culture. Then identify key principles to recognize essential element of effective the culturally sensitive care models. We have to approach to more better the patient-centered care by using the culture sensitivity, value and belief of the patient. Actually, the different ethnicity, the difference of the culture, this is actually an asset, important asset in the healthcare. Not a problem, but very, very important asset, because we have to consider the patient value, preference, according to their own social culture value and belief also. So promote the collaboration. We have to integrate, to encourage partnership between traditional healers and the medical profession. This may be the new strategies, how to overcome the current issues related to the modern, medical services, or more to the modern. Okay, next slide, please. Okay. What is the culture-based process? When we talk about the culture, we will consider about the values, the beliefs and reputation, and what normally practice in the original community. So in this context, we will bring together our belief, then social culture value and belief into the mental health care services. Actually recognizes the culture shape, how the people understand and experience the mental health. We know that, and the health concept also influenced by the culture. We know that in the mental health actually in between adaptive and maladaptive behavior. That basically adaptive and maladaptive also greatly influenced by the culture. include the sick perception, the symptom perception also very depend on the social culture value and belief. Therefore, the cultural-based approach may be one the new important that we have to develop and incorporate into mental health services. There is a theoretical foundation actually based on the anthropological and the cross cultural psychological research. Actually, anthropological ilmu tentang manusia. Just now actually Dr. siapa tu tadi Khadijah very fasih in bahasa alhamdulillah so maybe I'll mix also. Okay, incorporate social determinant of health within the specific culture context. So we know in the mental health also there is some disparities. The example we recognize one of the mental health also as an issue as part of the vulnerable population that we have to take attention, and then we have to improve our service, mostly based on the cultural value and belief. Then core element of the culture-based approach include the cultural, the humility from the providers. The providers has to improve the cultural competence in the daily practice. Integration of the local healing tradition. We know the patient life in their own cultural context. Actually, in each tradition, originally we have the various original traditional remedies and treatment. And so, contextually, we are relevant intervention. So we have to consider the relevancy, because in nature, we have to consider the mental health is a chronic disease. Actually, all of the chronic diseases normally will need the self-care. Self-care to take a decision and a treatment in their daily practice. Actually, for every patient will need to practice and will need the support from the community, specifically from the family. Then the community participant is very important because in the healthcare system we have to activate the support system, specifically family and the community. The next slide, please. Mental health concept across culture. So we have to consider the existing healthcare practice on the mental health services. Firstly, Western perspective ataupun pandangan Barat that emphasize individual pathologic and the biomedical model. Actually, Western perspective more focused to the modern medical process. Jadi maju dengan teknologi perawatan ataupun teknologi kedokteran. Then focus on symptom reduction and the functional restoration. Actually, more to the physical or more to the real problem, and then less the social approach, the samples. Maybe we have to identify what the strength and what the weakness from the Western perspective. Accordingly, the WHO actually recommend to integrate with what we call as an alternative or maybe the complementary care. The what of the introduction we have to highlight according to where actually our life. Different with the Eastern perspective, like Asian countries population, and emphasize mind body balance and spiritual harmony. Maybe Prof. Sharon just now, actually your country actually very famous also about this one, the mind body balance, and some practice like yoga, the assembly and others. However, actually like Malaysia, Brunei, Indonesia, actually more to the spirituality activities. Everything actually will be correlated with the spiritual balance normally. They focus on the holistic wellness and the community integration. We have to open our mind. Our community actually demand not only with the modern medical treatment, but they also demand to use and practice their own original value culture for the treatment. Remember, actually the community has their own original self-care. Whatever the disease, 80% patient before sick, before go to the clinic, before go to the hospital, actually practice the self-care. Self-care by using their own traditional remedies, maybe traditional value and belief. This may be the basic concept that we have to integrate the Western perspective and the Eastern perspective. Okay, we have some research also together with the PhD student related to the spiritual life, like in Medan and in Palembang. So this was significant, actually applicable to reduce the psychological problem and the mental health issues. Then indigenous perspective emphasize a connection to the nature, ancestors, and the community that focus on the restoring the social and the spiritual harmony. And then the cultural impact on the care, actually influence the symptom presentation and health seeking behaviors. Actually, and culturally, we have actually the typical behavior related to the culture, value, and belief. That's simple. Why? This disease like a DM, simple. Actually, the diagnosis. This is actually because of the culture. Actually, the most type 2 DM, the simple diagnosis after 5 years after presentation of the complication. This is actually because of the culture. Other issues in mental health is simple. I mean, difference with the general hospital, that's simple. Actually, like a taboo when the healthy people then go to the clinic and mental health clinic or mental hospital, just only for check. That's simple. This is only one issue that we have to cover with the culture. Okay, next slide. Okay. The model behind of the practice of the culture, we actually wrote it from the health belief model and the culture, to improve the perceive about the self-efficacy. Actually, culturally will inform the confidence in the taking health action, and then this will associate with the perceived the benefit and barriers. So we have to introduce to the community about the the mental health services. So to improve the awareness about the benefit and barriers for the social, culture, value, and belief. Culture values affect the cost benefit analysis, the perceived susceptibility and the severity, and cultural interpretation of the mental health risks. Then the cultural foundation actually become greatly important. Traditional values, belief, the community norm. We have to incorporate in the healthcare services. Okay, next slide, please. Okay, maybe I present faster, so later we can discuss if anything need to be discussed. We have to understand. I'm familiar with Indonesia. However, we can discuss about Malaysia also later. Actually, Malaysia is the Indonesia multi culturalism, and actually, and there are a lot of the ethnicity, and that has their own the tradition and the habitation and some product, traditional product. The example like in Java, the small Java was considered as the dominant tradition. The effect in the healthcare system also. Others like the simple Malay, the simple Sudanese, and this also considered as the dominant race, and the influence in the healthcare practices. Okay, next slide. Okay, why culture matters in the mental health? Because there are some evidence that we have to control and we have to improve our service. in about 45%, yeah, there is a treatment avoidance. Yeah. We know that the treatment actually one of the stress also for the chronic disease patients included the mental health. Why? Because the symptom, the side effect, the simple actually often become a burden for the patient. Percentage of the patient reluctant to seek the formal mental health assistance actually low. Then in about 76%, the cultural mismatch. The patient who feel conventional care, it doesn't align with their values. And this may be, the professional has to learn also the culture, value, and belief of the patient if you want to improve the practice. Then increase dropout, actually stop from the medication or from the treatment because culturally mismatched. The patient are more likely to abandon treatment. Then another issues actually about stigma. Yeah, about stigma. Yeah, that previously Dr. Hadija also mentioned about stigma. Yeah, 62%. The stigma actually impact to the accessibility of the mental health services. My next slide, please. Okay. Yeah. So we have to analyze, there are some limitation of the conventional model. When you talk about limitation, actually we doesn't forget then the advantages, because everything normally has the advantages and the disadvantages. However, because we're talking about how to incorporate the cultural base in the mental health service, so automatically we have to understand what the strength and what the limitation. In fact, only about 18%, this is only based on the study, in Papua, the psychiatric services actually is part of availability. Actually, the accessibility is actually very low. Very low. Actually, in average, the perception about the mental health spaces only for what we call it sebagai orang gila, seolah-olah macam tu seolah-olah orang yang datang ke mental hospital ni, patient only with the mental disorder. Actually, like the health promotion, the health prevention, like a screening, the sample, only the checkup, the simple medical checkup, for the mental health. Actually, it look like, because of the stigma, takut dikata gila dan sebagainya. Then next one, the language barrier. Actually in some the remote region, has the language barriers. In this, the professional terminology, the term, medical term, actually often lack equivalent, the concept in the local language. Therefore, we have to use the local language, in order to improve the cultural competence. And cultural dissonance, Western therapeutic approach may conflict with the local worldwide. We know actually in Indonesia also actually was familiar. The treatment not only more to the simple pharmacological treatment, not only the medical treatment, but like what we call it as the complementary care. The simple also was widely recognized and practiced in Indonesia. Then access challenges. Centralized services remain inaccessible to rural and the traditional. This is actually the classic symptoms, or classic problem from the limitation of the conventional models, because the most facilities actually in the urban or in the city. Okay, next slide, please. What is the positive impact of the culture? Actually, you can compare this only based on only research, based on the survey. There is actually a difference in the response between the conventional and the culturally approach in the healthcare services. Actually, in average, like service uptake, the sample people who access the healthcare actually higher if we use the cultural approach. Like the treatment adherence, because we use the material and the practice and the terminology, what the patient known. So, I mean, the population is actually common with our space. Therefore, the adherence also higher, including the patient satisfaction. Yeah, because we know that patient, you have to consider patient need and the patient expectation. Yeah, with the patient expectation or the patient want, actually when a patient expectation is met, so the satisfaction will increase. Include the symptom, the symptom reduction, actually better, because the outcome of care, in average actually will be better if we consider the cultural values. Go next slide, please. Go ahead, this one. Okay. Oh, yes. Okay. Slow it down. Okay. Okay, cultural service model for the core principle. Yeah. This is the principle for the culture-based service model. I mean, the key understanding is the collaboration partners, because we never work alone, and we have to engage in the expert, and then the traditional healer, the existing in the community, and the medical professional, include the spiritualized example. What maybe we call it in bahasa Jawa, we call it as the dukun. Dukun actually the term, actually not really bomoh in Malaysia. Actually, I mean the traditional expect remedies that simple, so we can involve positively to enrich our the collaborative partnership. Then the cultural flexibility, the adapting the approaches to respect and incorporate the local tradition. Then the community leadership. So we have to engage the leader or the public figures in the community. Because we know that in the community, the position of the public figure is very important. Actually has the power. We have to empower the local communities in service design and delivery. Then evidence integration. Actually, when we develop something, so we have to consider the scientific evidence. Basically, the simple research example, like I mean the simple Islamic intervention. The simple is for the actually the simple like a mortal. The simple. I mean, you have to search the existing evidence. For implementation, not only searching, but we have to review also, the appropriateness, before intervention, or before we use the research as part of the development of the culture-based intervention. Okay, next slide. Local community engagement. This may be one important principle in the mental health. I mean the community, community base, because the context is culture. When we talk about the culture, we have to activate in the community as the support system. Like a village health cadres, actually, in Malaysia, the cadres is, has a very important role. They may be close with the community. Specifically for the mental health in the community, basically we have to activate the cadres, they're simple in the health promotion and the health prevention mostly. The simple in Aceh also, they mostly common with the Islamic the cultures. So this actually has contribution to support the mental health need in the community. Then cross-culture training. The healthy professional, learn local custom, belief in the communication style. Actually, because the culture actually influence in the relationship. So this may be one strategy to understand and to increase the cultural competence among the health provider. Then community awareness. Educational program designed with delivered by the local community leaders. So we have to engage the local community, figures to actually more, improve the accessibility of care. Okay, next slide, please. Integrating traditional and the modern services. Actually, just now, actually the Western and the Eastern perspective, we have to integrate, so we have to cultural assessment, we have to do the cultural assessment, to identify relevant local healing tradition, and belief, because its tradition, its ethnicity, their own very specific the traditional healing product and healing process. Like Indian, the simple also practice in Malaysia, like Ayurvedic, the simple. Like in Java, maybe like a Jammu, the simple. So we have to identify everything. Include the practice about the belief. About the belief, because mental health, like mental health. Etiology of the causes, also sometimes actually related to the, belief, so we have to do the assessment, from the basic, to get the basic information about the traditional healing and belief. The stakeholder dialogue, so we have to discuss with the healthcare providers specifically, then we have to engage the community, the community elder or the public figures, to design the service for the mental health care. Then collaborative implementation. Okay, the integration design, we have to blend the protocol. So we have to improve the flexibility of the service, just to modify or to integrate the culture, value, and belief into the practice. So we have to respect about system. Maybe the modern protocol and the cultural belief. Then the collaborative implementation, deliver services through the partnership team. Actually, like in this example, we have to collaborate with others team, there's some psychologists or maybe psychiatrists, and others, the traditional healer, may include the spiritualize itu yang tadi saya sebut, yang dalam komunitas kita itu disebut dukun-dukun itu bukan bermakna selalu bemuh, dalam masyarakat Jawa Barat kita panggil dengan spiritualis macam itu. So actually we can engage, why? Because the community know them, mereka semua tahu perihal yang apa yang mereka hari-hari buat. Okay, next slide please. And locally based telemedicine, innovative. Actually, we can use the modern the digital technologies, because recently and during the digital era, our community also have familiar with the digital product like handphone, simple. So telemedicine also practice widely in Malaysia and Indonesia. So actually we can apply for the culture approach of the mental health services. Digital platform with the multiple multilingual features enable access to in remote area. Like a chatbot also can be used as psychologists with the cultural expertise, provide the contextual relevant support. Okay, next. Okay, developing culturally sensitive human resources. And so we have to improve our awareness, public awareness, and the healthcare provider awareness. The cultural awareness is, the culture is important. Important because culture as part of the life. Because human life actually life together and doing the culture. We cannot avoid the culture, then we cannot live the culture. And therefore, the recognizing the culture, on the culture bias, include the bias on the cultural issues, we have to be to identify, because the cultural actually not only influence, but the culture sometimes also become a gaps. So therefore, we recognize the cultural gaps, and there are some maybe practice that doesn't associate with, doesn't relevant with the medical practice or the healthcare practices. They're simple, so we have to identify. They're simple like in the mental health. Kalau zaman dulu orang gangguan jiwa ini dipasung ke kampung sebagai contoh. Actually, the culturally gap that doesn't appropriate with the modern medical or the healthcare practices. And then we have to improve the culture knowledge, learning process about the diverse culture framework. So we have to bring the culture. A culture usually look like traditional, that previously look like outside of the healthcare system. So we have to bring in together into the healthcare system. Then we have to introduce, then we have to incorporate in the healthcare system. Why? Because there are a lot of research already about practice associated with the culture practice related to the mental health. But PTB actually doesn't formally what I mentioned about the practice actually in the research. There are a lot of research practice that possible we have to incorporate in the daily practice. But then we have to improve the cultural skill. They're developing the specific intervention adaptation, then cultural practice, implementing culturally responsive care. We have to improve the cultural competency among specifically nurses or the healthcare, mental health services. Okay, next slide. The educational and awareness material. This is actually how to improve the knowledge and skill and practice for the cultural base. So we have to use the media that are simple like this one. The cultural storytelling, simple folk tales, and the traditional characters make concept accessible and relatable. This is really the physical. Digitally, like you can develop also, we can develop the simple digital base or Android base, and the education about the culture, involvement in the mental health care. That's simple. Include the campaign about the bebas stigma, free from the negative stigma, because the accessibility of the mental health care services actually greatly influenced by the stigma. Nationwide initiative in 65 districts, as simple, they use the culturally relevant message to reduce stigma. Actually, there are a lot of strategy also in the research to reduce the stigma. That mostly actually through the education, physically, then use the leaflet, use the module, and then use the page flip, the simple, then also in the specific or particular website. Then arts-based education. Actually, we can engage in the traditional art form to convey the mental health concept in a culturally meaningful way, included for the therapy and for the treatment, because the cultural art actually like a drawing, the simple also can be used to explore in the mind, the content of the mind, and to reduce the mentally burden. Okay, next slide, please. Okay, program monitoring and evaluation. So, if we develop the cultural base mental health services, actually we have to set out also the program monitoring and evaluation. The culturally informed design. So we can develop the metric respecting local values and the expectation. Yeah, I mean, we have to do the survey because the best development actually, yeah, based on the maybe survey, or maybe you can invite the experts, yeah, related expert, yeah, to develop or to design the culture-based services. The language adaptation. So we have to consider to use the local and easy language because the service actually influenced by the language and culture sensitivity. Then inclusive implementation is we have to collect the feedback during implementation across the demographic, like age appropriate method, the simple, and then ethnic representation, the simple. Then the contextual analysis, interpret the result through the cultural lens, like a local expert involvement during the implementation, during the evaluation, and maybe the follow-up. Then the community validation. Remember, when our project the community based, so we have to engage. Because in our culture, actually the program address for patient and done by the actually for community and also done by the community. The responsive adaptation, refined based on the culture inside, like the community lead change. Actually, we have to respond in the situational condition based on the progress and the development. Okay, next slide, please. Okay, cross-sector collaboration that we have to engage healthcare services. Actually, the facilities like a hospital, the community health centers in the puskesmas, pusat kesehatan masyarakat, and the psychiatric facilities. Why? Because when we talk about mental health, not only talking about psychology and maybe mental, because some also related to the physical disease. Therefore, we have to collaborate with the other healthcare providers. Then the education sector, like school, as example, we actually have the school health, then universities, and the educational authorities. Then we have to work together also with the religious institution, like mosques, then church, temples, and the religious schools, and then social services, social welfare department, and the community development. Then we have to engage also the traditional structure, like village council, simple tribal authorities, and healing network, and others form of the traditional, maybe traditional organization or maybe traditional body. The next slide, please.
5 minutes to go, Dr. Tukimin.
Okay. Yes. Okay, so this is to inspire. We have some practice, so we have to learn maybe from this case study. The integration approach actually practice already, like a narrative therapy. They're simple by using the oral traditional, and then the symptom description using the local idiom. They're simple. Use the local language. Then ceremonial. I mean, we know that the population actually has a routine or maybe look like enjoy with some ceremonies, so we have to involve the traditional ceremonies, including the mental health services. Then collaborative structure, the program unit, like a church leaders, as a trust, the intermediaries. Actually, in last month ago, actually from Sulawesi also come. Actually, they are also has activities related to the mental health. But the activities actually come from the church. But traditionally, I mean, there is no the professional involved. Maybe in this context we have to engage. And the people has activities mental health, but without the professional approach. So we have to educate them and to improve the service. And community health center staff, then the tribal elders guiding the cultural appropriateness. With the outcome, Yeah, after 2 years implementation, actually there is increase in about 68, 68%, actually increase in service utilization, actually accessible, become actually accessible. And 74% the treatment completion rate. And this indicates the increase in the adherence to the treatment. The reduction of the stigma reported by 82% of the community members. Okay, next slide. What is actually University of Java also we recognize this one as a Jiwa program. Actually, this kind of the counseling by using the local language, by using the Sundanese language, the culturally competent training, in Sundanese also. This pesantren also, actually we use the pesantren actually look like the traditional institution look like, but actually this they consider as the school. Pesantren is a kind of school, and we can engage, because pesantren has their, a student, and we have to engage to maintain, prevent or the mental health. The religious teaching, example, you can involve, we can give input to the ustad here to inspire and in prevention of the mental disorder, or to improve the mental health in pesantren. Okay, next. Okay, in Aceh, we know that Aceh is really more, the Islamic, the culture. Actually, the tradition actually strong, with the Islamic reputation. Actually, in Aceh was implemented Quranic healing integration. The traditional Islamic healing practice incorporated into the therapeutic protocols with the clinical side. Regarding the Quranic, actually, there are two research already done by the student. And the Quranic actually was significant to improve and the relaxation, like pain also, and then reduce the anxiety and depression. Then Daya professional collaboration, like this one traditional Islamic school, Daya, work alongside the psychologists and the paramedic in structured referral system. The community-based support, the village level mental health advocates and trained to provide basic support and appropriate referrals, then documented success. Based on the evaluation, actually there is significant increase about the accessibility and better outcome of the service. The next slide. Okay, this is a challenge maybe possible found in Indonesia. If we implement the cultural base, and the most common recognized challenge is the human resource shortage. Because this will need the expert related to the traditional intervention. The simple, if you want to implement or incorporate the simple Islamic intervention, the simple, automatically you will need the expert, the simple. Or maybe you will involve the traditional. However, actually, just know through the collaboration actually can be done. But the issue is still this one. Human resource shortage. Then cultural stigma. Actually, at the time of the mental health disorder, orang mengalami gangguan jiwa, ini dalam community, dalam komunitas ini masalah. Actually, there is an issue in Indonesia, and the majority of people who overcome or cure from the mental health, and actually to relapse because of the stigma of the community, the acceptability of the family and the community. Then the barrier, barrier, because they actually mountain, the gunung-gunung, then they spread in the different island. Actually, ada 5 pulau. This may be one of the barrier. The limited funding, this may be the common issues, not only in Indonesia. Then policy framework, this will need the policy makers, they may be related to funding and with politics also, this one. Okay, next slide, please. Okay, strategic opportunities and direction. Actually, in Indonesia we recognize the regulation by MOH, Minister of Health, but increase the budget allocation, the cultural responsive mental health program. This one's existing strategy. The technology development, grow digital infrastructure. This actually will need the development. Will need more research and the implementation for the future practice. Then capacity building, actually in academic, in the university, there is simple to improve then awareness and knowledge and awareness on the culture, importance of culture in the healthcare. So we have to include in the university curriculum. Then research funds, it's investment, actually development of the new product, then development of the new strategy, specifically in daily operational, by using the cultural base, and this will need the development, implementation, and research. Next one. Okay, as a conclusion recommendation, integrate culture element, formally incorporate cultural practices into standard mental health care protocol, then enhance training, then expand research, then strengthen the policy. I mean, we have to engage the policy maker, specifically in the Ministry of Health Indonesia. Okay, thanks for your attention, and maybe go to the next step, question answer. Thank you.
Yeah, thank you, Dr. Tukimin. Please give big applause for Dr. Tukimin. Yeah, thank you. So the next section is discussion sections. I will give one question from offline or online. Okay. Anyone questions? So, Dr. Tukimin, according to you, the cultural-based approach involves the community, local community, or social community. The question is, aside from the policymakers, what kind of the involvement or the role from the government to implement the cultural-based approach?
Yeah. Okay. Okay, thanks for the question. Actually, when we talk about the cultural, so we have to bring to the related, just know the regulation. Actually, previously I saw in the, in the policy, specifically from Indonesia, from the Ministry of Health Indonesia, there is actually a law or like the regulation. So under the umbrella, actually we can identify, we can start to clearly recognize the potential for the healthcare. The culture base for the healthcare development, and then we have to link also because the culturally actually not independently as the new. Actually, this is not really new because the culture base, if we classified into the A, actually this includes in the holistic care. Holistic care, when we talk about the holistic nursing, holistic health services, normally, automatically we have to include the cultural. Like the simple what already practice, specifically during the research, the simple like in Medan, actually recently we implemented the integrated, we call it the integrated spiritual care, to reduce the stress and anxiety among chronic disease patients. Yeah, simple. Yeah, this will exist in practice. In practice already. Yeah, so like in Palembang, in Palembang also already practice. Also, this is like use the Quranic Quranic, then use the module, yeah, and then they measure the spiritual life, and measure, yeah, the stress and depression, yeah, among cardiac arterial disease, yeah, or cardiovascular disease. Yeah, this is actually practice. Yeah. Actually, I mean, our community actually was recognized. Yeah. Then some remedies also was recognized. Yeah. So if we classify all of this actually considered as the non-pharmacological therapy. This is considered as the complementary, not to replace. Yeah. So we have to understand, yeah, not to replace, yeah, the existing conventional, or we call it as the modern practice. Yeah, but we integrate, yeah, integrate with the existing. Yeah, maybe, yeah, if for us long time, in the orientation of the treatment, yeah, more to the medical, the simple. Yeah, we know the medical, yeah, normally highlight that the pharmacological intervention, the simple. Yeah, we know that medical intervention, yeah, also has, the advantages and disadvantages. Yeah, this is like anxiety, this symbol, yeah, anxiety. Actually, the anxiety occur, yeah, actually because of the process of the feeling, the psychological process, maybe because they feel in the adaptation, or maybe the expectation difference from the reality, that simple. This usually come from the daily life. Actually, this can be approached. I know that in Indonesia, yeah, we have what we call as the therapeutic communication. Everything, yeah, in the mental health practice, actually, we have to use and practice in the therapeutic communication. And this may be one good technique. Yeah. However, more than that, we have to involve in the culture. Because if we incorporate the culture, the patient will recognize, yeah, and know, yeah, how, yeah, to control and how to improve, yeah, the outcome of care. I mean, this maybe, okay. When we talk about the policymaker, this actually will need, yeah, just know, yeah. I mean, the research, then research has to publish, then the research has to recommend, and then hopefully in future the policymaker also conduct the research. Yeah. Okay, actually, as a long time, like in Medan, the simple one CEO of the hospital developed. I mean, the integrated the spiritual care. Yeah, actually, this will become a policy in hospital. Maybe, yeah, we start, but when we talk about the implementation, yeah, this will take time, will take process, yeah. However, during nursing practice development, yeah, we have to address, yeah, to improve the quality of care and quality of outcome of care. When we talk about the quality, so the quality is not status. Quality is not status. The quality is the process. Yeah, I mean, we have to do the step by step and maybe the continuity of the process. Yeah, then later maybe the policymaker, will consider, yeah, to incorporate, yeah, the form, the form of the cultural based mental health services. Okay, Pak, ya.
Okay, thank you. Anyone? Raise a hand for questions. Okay, I think Dr. Tukimin, we reached in the end of our seminar here. So everyone give big applause for Dr. Tukimin. Yeah. The next section is a presentation of the certificate for Dr. Tukimin. Please.
Yes, Pak Eko. Yeah, Pak Eko.
Yeah, Dr. Tukimin, this is the certificate. We really great appreciate for your presentation in this seminar. Yeah.
and we have a take a picture together.
Okay. Before you leave, everyone prepare to take a picture.
Okay.
Open your camera.
Mhm.
Yeah.
1, 2, 3. Pak Jai. Yeah, and then next. Yeah, Pak Eko. Thank you.
Okay, thank you, Dr. Tukimin. Hopefully see you in the next seminar or the next events. Yeah, thank you, Dr. Tukimin, and give applause for Dr. Tukimin. I think this is the end of our seminars. Before we close the seminar, I would to say rhyme. Yeah, please say cool or keren. Yeah. The sun now sets. Our time well spent. With knowledge share and heart intent, like river flowing to the sea. Take these lessons and rise boldly. Yeah, thank you. Appreciate for us. Thank you, and I sincerely apologize for all the mistakes, and I obviously close for the seminar. Thank you, and Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Tukimin.
Dapatkah kamu bayangkan kampus yang menjadi pionir pendidikan tinggi di Pekalongan ini adalah kampusmu di masa depan? Kampus dengan 3 fakultas unggulan, FEB, FIKES, dan Pastikom. UMPP menawarkan pendidikan berkualitas, fasilitas modern, dan lingkungan akademik yang kondusif. Inilah kampus yang mendukung impianmu, membentuk karaktermu, dan mempersiapkanmu menjadi generasi yang berdaya saing menghadapi tantangan global.
Selamat datang di Universitas Muhammadiyah Pekajangan Pekalongan.
Tempat di mana pendidikan bertemu dengan inovasi dan prestasi.
Inilah tempat di mana mimpi-mimpi besar dimulai dan masa depan gemilang direncanakan. UMPP lebih dari sekadar tempat belajar. Ini adalah titik awal perjalanan luar biasa dalam hidupmu.
Universitas Muhammadiyah Pekajangan Pekalongan hadir dengan visi menjadikan universitas yang unggul dan berdaya saing internasional berdasarkan nilai Islam pada tahun 2044.
UMPP menyediakan 3 fakultas unggulan dengan program studi yang dirancang untuk menjawab kebutuhan zaman. Fakultas Ekonomi dan Bisnis hadir dengan program studi sarjana akuntansi, sarjana manajemen, dan sarjana ekonomi syariah. FEB berkomitmen untuk mencetak generasi profesional yang siap menghadapi tantangan dunia kerja di era globalisasi. Dengan 3 program studi andalannya, FEB menawarkan beragam peluang untuk mewujudkan impian mahasiswa. Bagi kamu yang ingin terjun dalam dunia analisis keuangan, audit, perpajakan, serta pengelolaan sistem informasi keuangan, program studi akuntansi sangat cocok untuk kamu. Kemudian, program studi yang tidak kalah eksisnya, yaitu program studi sarjana manajemen. Di sini, kamu dibekali dengan kemampuan strategis di bidang manajemen, bisnis, dan kewirausahaan. Mahasiswa akan dilatih untuk menjadi pemimpin visioner yang mampu mengelola sumber daya secara efektif dan mengambil keputusan berdasarkan analisis data. Selanjutnya, ada program studi sarjana ekonomi syariah yang dirancang untuk menjawab kebutuhan dunia terhadap sistem ekonomi yang berlandaskan syariah. Mahasiswa akan memahami prinsip ekonomi Islam dan bagaimana menerapkannya di sektor perbankan syariah, investasi halal, dan keuangan Islami.
Fakultas Ekonomi dan Bisnis UMPP adalah tempat bagi para calon pemimpin masa depan yang ingin berkontribusi dalam perekonomian bangsa dan membawa perubahan positif di tingkat dunia.
Kemudian, ada Fakultas Ilmu Kesehatan. Sebagai pilar pendidikan kesehatan di UMPP, Fakultas Ilmu Kesehatan memiliki beragam program studi yang memastikan lulusannya siap bekerja dengan standar kesehatan nasional dan internasional. Bagi kalian yang memiliki jiwa sosial tinggi dan ingin berkontribusi langsung dalam pelayanan kesehatan masyarakat, program studi Diploma 3 Keperawatan dan Sarjana Keperawatan adalah pilihan yang tepat. Di sini, mahasiswa dibekali dengan keahlian klinis, komunikasi yang empatik, serta keterampilan pengambilan keputusan dalam situasi kritis.
Program ini dirancang untuk menghasilkan perawat yang mampu memberikan fasilitas kesehatan yang berkualitas, dari fasilitas kesehatan dasar hingga rumah sakit yang besar.
Buat kamu yang mau jadi perawat profesional, pendidikan profesi nurse mempersiapkanmu untuk menjadi perawat dengan keahlian klinis tingkat lanjut. Program ini menekankan standar praktik yang tinggi, sehingga lulusan siap menjawab tantangan di dunia keperawatan global. UMPP juga memiliki program studi untuk kalian yang tertarik pada dunia obat-obatan. Sarjana farmasi dan pendidikan profesi apoteker memberikan pendidikan berbasis sains yang mendalam, meliputi formulasi obat, pengawasan mutu, hingga pengembangan produk farmasi inovatif.
Farmasi memastikan lulusannya siap memenuhi kebutuhan masyarakat akan obat-obatan yang aman dan efektif.
Di UMPP juga terdapat program studi sarjana fisioterapi yang unggul, mencetak lulusan yang mahir di bidang muskuloskeletal non-bedah, dan membantu memulihkan mobilitas gerak serta meningkatkan kualitas hidup masyarakat.
Dengan pengetahuan dan praktik yang terkini, lulusan fisioterapi mampu membantu pasien memulihkan mobilitas, mengurangi nyeri, dan meningkatkan kualitas hidup melalui pendekatan berbasis bukti ilmiah. Peduli pada ibu dan anak. Yuk jadi bidan profesional di UMPP. Sarjana Kebidanan dan Pendidikan Profesi Bidan dirancang untuk mendidik bidan profesional yang berfokus pada kesehatan ibu dan anak. Program ini mencakup keterampilan yang mendukung persalinan aman, perawatan pasca melahirkan, hingga pelayanan kesehatan reproduksi dengan pendekatan yang manusiawi dan berbasis komunitas. Olahraga adalah passionmu. Jadikan itu karirmu di Sarjana Pendidikan Jasmani. Di sini memberikan dasar ilmu pendidikan dan olahraga yang mendalam. Program ini bertujuan mencetak tenaga pendidik dan pelatih olahraga yang mampu mendukung gaya hidup sehat, kebugaran masyarakat, serta prestasi di bidang olahraga. Lulusan Fakultas Ilmu Kesehatan UMPP dipersiapkan untuk menjadi agen perubahan di dunia kesehatan, membawa kontribusi positif bagi masyarakat, dan mampu bersaing di tingkat nasional maupun global. Bayangkan sebuah fakultas yang menjadi pusat inovasi teknologi dan tempat di mana ide-ide brilian diwujudkan menjadi solusi yang nyata. Fakultas Teknik dan Ilmu Komputer UMPP adalah ruang bagi para visioner muda untuk mengeksplorasi dunia teknik modern dan teknologi digital, membekali mereka dengan keterampilan dan wawasan global untuk membangun masa depan. Apakah kamu tertarik menciptakan solusi inovatif di dunia teknologi dan industri? Program studi teknik mesin adalah tempatnya. Di sini, kamu akan belajar merancang, membangun, dan mengembangkan teknologi mesin modern yang menjadi fondasi sebagai sektor industri.
Lulusan program studi ini siap berkarir di berbagai sektor industri.
Namun, dunia industri tidak hanya bergantung pada mekanik. Teknologi digital juga memainkan peran besar. Itulah mengapa program studi informatika hadir untuk membekalimu dengan keterampilan di bidang pemrograman, artificial intelligence, dan pengelolaan data besar. Di dunia digital yang bergerak dengan cepat, ini adalah kesempatanmu untuk menjadi bagian darinya. Program studi informatika di UMPP membekalimu dengan keterampilan terkini di bidang pemrograman, kecerdasan buatan, dan keamanan siber. Lulusan informatika UMPP dipersiapkan untuk menjadi pemimpin di dunia digital. Fakultas Teknik dan Ilmu Komputer yang fokus pada inovasi teknologi membuka peluang besar melalui program Sarjana Teknik Mesin dan Sarjana Informatika. Mereka membuktikan bahwa mimpi besar bisa diwujudkan dengan semangat dan kerja keras. UMPP juga menyediakan berbagai program beasiswa untuk mendukung setiap mahasiswa yang berprestasi dan berpotensi, sehingga pendidikan berkualitas bisa diakses oleh semua kalangan. Dengan dukungan kampus yang penuh inovasi, setiap mahasiswa UMPP siap menjadi inspirasi dan membawa perubahan positif bagi dunia. Jadilah bagian dari UMPP, kampus yang tidak hanya mendidik, tetapi juga membentuk karakter, kepemimpinan, dan semangat berprestasi.
Ayo bergabung di UMPP, menjadi bagian dari masa depan yang gemilang.
Setiap tahun, Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan menghasilkan ratusan lulusan yang siap melakukan banyak hal luar biasa untuk kehidupan manusia. Pelayanan ibu dan anak, merawat pasien, pengelolaan sediaan farmasi yang benar, mengatasi permasalahan gangguan gerak dan fungsi, meningkatkan kebugaran jasmani dan melihat banyak senyuman. Inilah Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan. Kuliah di Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan merupakan langkah awal dalam menyiapkan diri menjadi tenaga kesehatan dan pendidik yang profesional. Seorang tenaga kesehatan tidak hanya merawat dan pharmaceutical care. Lebih dari itu, Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan siap membentuk mahasiswanya untuk memberikan sikap yang hangat dan memberikan pelayanan yang terbaik untuk pasien. Selain menjadi tenaga kesehatan, Fakultas Ilmu Kesehatan juga mencetak calon pendidik yang terampil dan berdedikasi tinggi di bidang olahraga. Tidak hanya pasien, mereka juga disiapkan agar bisa berkomunikasi dan berbagi pengetahuan secara efektif kepada profesional kesehatan, masyarakat, dan pihak terkait dalam peningkatan mutu pelayanan kesehatan dan pendidikan. Karena mereka adalah seorang farmasis, fisioterapis, perawat, bidan, dan guru pendidikan jasmani.
Setiap karir yang baik berawal dari pendidikan yang berkualitas. Selamat datang di Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan, tempat di mana mimpi besar Anda untuk menjadi tenaga kesehatan dan pendidik berdaya saing internasional terwujud. Dengan visi menjadi Fakultas Ilmu Kesehatan yang unggul dalam ilmu pengetahuan dan teknologi dengan penekanan bidang promosi kesehatan yang berdaya saing internasional berdasarkan nilai-nilai Islam pada tahun 2044, kami siap mendampingi langkah Anda menuju kesuksesan. Di FIKES UMPP, Anda akan ditawarkan 11 program studi dan dengan bangga kami sampaikan terdapat 3 program studi yang telah terakreditasi unggul, yaitu program studi sarjana fisioterapi, program studi sarjana keperawatan, serta program studi pendidikan profesi nurse. Dengan fasilitas modern, kurikulum berbasis teknologi, serta lingkungan Islam yang mendukung, kami percaya Anda akan tumbuh menjadi tenaga kesehatan dan pendidik yang profesional, kompeten, dan berakhlak mulia.
Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan terus berkontribusi untuk bangsa hingga saat ini. Untuk itu, Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan bersinergi dengan berbagai lembaga nasional agar bisa terus mengabdi untuk bangsa.
Perkenalkan, nama saya Tony Jajiko, asal saya Batang. Saya lulusan FIKES Kesehatan Prodi D3 Keperawatan di UMPP, lulus di tahun 2015. Berkesannya karena Yayasan Muhammadiyah, secara kita FIKES kita ditunjang banyak banget dari Muhammadiyah, kayak misalkan tempat kuliah yang bagus, ruang kurang mata kuliah yang ber-AC, nyaman, gitu. Ya mungkin sekarang lebih nyaman dari waktu zamanku ya, itu aja. Lebih proper lagi. Oke. Saya setelah lulus 2015, akhir 2015, terus awal tahun 2016 saya di tenaga surveillance kesehatan di Semarang sebagai demam berdarah, di bagian demam berdarah surveillance-nya. Terus setelah itu 1 tahunan saya ngambil pelatihan bedah dasar sama operasi di RSPAD Gatot Subroto Jakarta. Setelah itu saya kerja di rekanan di PT rekanan untuk ortopedi, misalkan untuk operasi servikal, tulang belakang, total knee replacement itu lututnya yang udah paus. Nah itu saya di PT-nya di Jakarta. Setelah itu saya cari informasi untuk Jepang dan sekarang bekerja sebagai perawat, tapi perawat lansia di rumah sakit Jepang ya. Total dari sekolah, saya sekolah bahasa Jepang 2 tahun setengah, terus sekolah kejuruan perawat lansianya, dan kerja total udah 6 tahun mungkin, 6 tahun. Kuliah di UMPP yang saya bilang tadi kesan apa yang berkesan, fasilitasnya nyaman, dari ilmu keagamaannya kita dapat. Saya bangga menjadi alumni Fakultas Ilmu Kesehatan UMPP. Melesat.
Seorang tenaga kesehatan akan selalu dibutuhkan sepanjang masa dan akan selalu menjadi pahlawan sepanjang masa. Dan bagi seorang tenaga kesehatan, melihat senyuman masyarakat dan keluarganya menjadi hal yang sangat berharga. Inginkah kamu menjadi seperti mereka? Mulailah perjalananmu bersama Fakultas Ilmu Kesehatan Universitas Muhammadiyah Pekajangan Pekalongan.
Marilah bergabung dengan FIKES UMPP dan jadilah salah satu bagian dari perubahan di dunia kesehatan dan pendidikan. Bersama FIKES UMPP, raih masa depan gemilang Anda di bidang kesehatan dan pendidikan.